Eastern Samar and 370 from Northern Leyte. This is the official report of the National Disaster Risk Reduction Management Council in 2016. The major objective of the study is to determine the community risk factors on the occurrence and prevention of diarrhea outbreak in Eastern Visayas. It has four specific objectives. First, to compare the characteristics of municipalities that had diarrhea outbreak in 2016 and those that did not have diarrhea outbreak. To compare the availability and adequacy of affordable medical care of communities that had diarrhea outbreak and those that did not have diarrhea outbreak. Third, to compare the health promotion activities conducted in communities that had diarrhea outbreak and those that did not have diarrhea outbreak. And fourth, to determine which of the variables and community characteristics, availability and adequacy of medical care, and conduct of health promotion activities in communities that are significant risk factors on the occurrence and prevention of diarrhea outbreak. For us to be able to attain the objectives, we did a case control study design where 41 municipalities in Eastern Visayas that had diarrhea outbreak in 2016 were the case municipalities, and randomly we selected 41 control municipalities from those that did not have diarrhea outbreak. However, due to lack of data of some municipalities, only 34 of the 41 case municipalities and also 34 of the 41 control municipalities were finally included in the data analysis. We collected existing data from different units of the municipal local government units. We used a researcher-developed data collection guide consisting of 45 items. We hired and trained two research enumerators who gathered the data from the identified 82 municipalities. The data that we collected from the municipalities were substantiated and verified with data that we sourced out from the Philippine Statistics Authority, the Department of Interior and Local Government, Commission on Audit, and the local government unit health scorecards from the Department of Health. We also used binary logistic regression analysis to determine the predictive ability of a mix of continuous and categorical independent variables to the odds that a municipality will have diarrhea outbreak. On the highlights of the results, we were able to establish in the study that case municipalities has a higher mean total population of 28,493 than the control municipalities of 21,579. Poverty incidence was higher in case municipalities of 46.83 than in control municipalities of 41.42. Case municipalities has lesser number of percent of households with access to clean water of 86.07%, while control municipalities has 89.82%. Case municipalities also has lesser percent of households with drinking water source compliant to biological standards of 56.11% than control municipalities of 61.24%. Also, case municipalities has lesser percent of households with sanitary toilets of 67.16% than control municipalities of 79.52%. However, case municipalities had a slightly higher mean percent of municipal budget allocated for health services of 10.68 than control municipalities of 10.24%. There were lesser number of case municipalities with sanitary waste disposal facility than in control municipalities of 20.6%. There were also lesser number of case municipalities with solid waste management program being implemented of 85.3% than control municipalities of 91.2%. However, there were more number of case municipalities who conduct regular water quality monitoring of its primary and secondary water sources of 61.8% than control municipalities of 52.9%. There were more number of case municipalities with local executive committee who attends to disaster outbreak problems of 73.5% than control municipalities of 58.8%. There were more case municipalities with local climatic condition belonging to climate type 2 of 67.6% than control municipalities. In terms of availability of medical care, these municipalities has a slightly higher mean number of healthcare facilities of 1.47 than control municipalities of 1.35. In terms of availability of medical doctors and nurses in relation to the population, case municipalities has lesser number of medical doctors. One medical doctor attends to 27,207 individuals, while in controlled municipalities, one medical doctor attends to 19,768 individuals. The same scenario is for nurses. Case municipalities has lesser number of nurses. One nurse attends to 20,762 individuals, while in controlled municipalities, one nurse attends to 16,144 individuals. On availability of non-hospital based diagnostic centers that serves a support system to the healthcare facility of the municipality, there were lesser number of case municipalities with two or more non-hospital based diagnostic centers of 5.8% than control municipalities of 8.8%. There were also lesser number of case municipalities with one non-hospital based diagnostic center of 8.8% than control municipalities of 14.7%. There were more case municipalities without non-hospital based diagnostic center of 85.3% than control municipalities of 76.5%. There were lesser number of case municipalities with available medicine and oral rehydration for diarrhea patients in government healthcare facilities of 94.1% than controlled municipalities of 97.1%. However, in terms of the municipality keeping records and surveillance data on diarrhea cases, it, it was the same both for case municipalities and control municipalities of 79.4%. On the conduct of health promotion activities, there were more number of case municipalities who conduct orientation on food safety of 82.4% compared to control municipalities of 73.5%. There were lesser number of case municipalities who conduct orientation on personal hygiene practices of 82.4% than control municipalities of 88.2%. There were also lesser number of case municipalities who conduct orientation on proper water treatment and storage of 76.5% than controlled municipalities of 79.4%. However, there were more case municipalities who conduct orientation on proper waste disposal of 91.2% compared to the controlled municipalities. The results of the binary logistic regression analysis revealed that 33.4% to 47.5% of the variations in the dependent variable, which is the occurrence of diarrhea outbreak in a municipality, is explained by the independent variables in the study. Looking at the beta coefficients, those municipalities with bigger total population and more poverty incidence were more likely to have diarrhea outbreak, or is a risk factor that the municipality will have diarrhea outbreak. However, those municipalities with lesser households having access to clean water and also lesser households with sanitary toilets are more likely to have diarrhea outbreak. For those municipalities with no executive committee for disaster outbreaks, lesser number of doctors, medical doctors attending to diarrhea victims, and no or lesser number of diagnostics non-hospital based diagnostic centers, and less available medicine and oral rehydration for diarrhea patients in government healthcare facilities, and lesser number of health promotion activities conducted. These are municipalities that are more likely to have diarrhea outbreak. Based on the results, we concluded the following: that community risk factors on the occurrence and prevention of diarrhea outbreak include big population, small percent of households with access to clean water, less percentage of households with sanitary toilets, local climatic conditions belonging to type 2, high poverty incidence, absence of an executive committee for disease outbreaks, few medical doctors relative to the population, less available non-hospital-based diagnostic centers, and the absence of the conduct of health promotion activities like food safety, personal hygiene practices, proper water treatment and storage, and proper waste disposal. From the results and the conclusions, we recommend the following. In order to prevent or minimize the occurrence of diarrhea outbreak in communities, municipalities may institutionalize the following. First, increase households' access to safe and clean water. Second, massive construction of well-designed sanitary toilets and its proper use and maintenance. Third, undertake measures to decrease poverty incidence. Fourth, create and activate an executive committee for disease outbreaks. Fifth, increase the number of government physicians and nurses in government healthcare facilities. Sixth, encourage investors for non-hospital-based diagnostic facilities. And seventh, conduct of massive health promotion activities among the constituents of the municipality.
All right, thank you, Dr. Miralles. I believe our Board of Judges are now ready to ask you their question.
5D,
Can I have the floor,
6C,
April?
7D.
Sure, sir, go ahead.
Okay. Good morning, Dr. Miralles. Thank you for your
10B,
presentation of your research.
11B.
Uh, Actually, I'm from Department of Health and I'm very much familiar with disaster response in the LGU. I am just particularly curious about you mentioned the Executive Committee for Disease Outbreak. How did you operationally define Executive Committee for Disease Outbreak in your study? How different are they from the local health board or the disaster risk reduction management in the municipality?
This local executive management or local executive committee that is supposed to handle problems, issues regarding disease outbreaks. This is a somewhat uh, it could be considered similar, but it does not. It's not a duplication of the municipal health board because what we intend to do, what we are proposing is for municipalities to really create such kind of body who will who is dedicated and who will focus to issues relating disease outbreaks. I know in respective municipalities there is already a local health board, but then this local executive committee will really focus on disease outbreaks. I
Okay.
hope I answered the question, sir.
Yeah, I don't know if how could that be possible because the local health board is a system that has been established by the Department of Health in coordination with the LGU, and then questioning the integrity of the local health board and substituting it with the executive committee is something unusual for me as a public health worker. But anyway, thank you for your answer.
Can I say something, Pastor?
Okay, yeah.
Yeah, the local executive committee, the membership, the constitution of which uh, will not just be the key personnel in the rural health unit. It will include key personnel in the disaster risk reduction management council and also within the Sangguniang Bayan, and of course the local chief executive of the municipality. This is a specialized committee who will really have to focus on occurrences of disease outbreak, problems and issues related to occurrences of disease outbreak.
Okay. Can I ask another question?
Yes, sir, of
Okay,
course.
you mentioned that municipal health budget for health. You compared the two areas, case municipalities and control municipalities. You compared it in terms of availability of municipal budget for health. Do you think it is this the sensitive indicator rather than using specific budget for diarrhea control? Because if you say municipal budget for health, there can be budget, but this budget can be used for other purposes like immunization or mobilization of the health personnel. Do you think it is the right variable or parameter rather than mentioning specific budget for diarrhea control? Because yeah, the reason that I mentioned to you earlier, there could be budget, but the budget was not for diarrhea prevention. There's a budget for other purposes like for immunization activities. But do you think you did the right variable, select the right variable?
Based on the data collection activities we did, even only in trying to get information on the percent of budget that really goes to health services, this is one of the variables that into which we found difficult to get the data because there are a lot of LGUs who do not divulge. They will not tell us. They did not tell us about how much budget is really going to the
the health services of the municipality. This is one of the variables where we sourced out data from the Commission on Audit, because it was only in this study that I knew that local government units are supposed to submit annually their financial reports. So we were only able to look into this part of the report. Uh, uh, if we will have, actually, it would be ideal that we really have to look into the how much budget was devoted to diarrhea outbreak, but that would be a very difficult data to take.
Okay.
All right.
Actually,
So
you can get that from the RHU. Thank you.
okay, I believe Dr. Huban already also has a question.
Yeah, okay. Ma'am, thank you for your presentation.
Thank you.
Based on the perspective of a researcher or an epidemiologist, looking at the way it was done and the terminologies used, I would probably favor something like so more of a comparison between municipalities with the with diarrhea cases at a higher, and the other one is who did not experience the uh, the said condition rather than a case and a control study design, because the case control study design implies that there is some matching variable to compare one municipality over the second municipality which you as control. The way it was done is was getting all the information and of those without the condition, with those without the epidemic and those with the epidemic. Looking at your table number one, the basis, the demographics or the uh, factors that you mentioned are not too different from the two, meaning the population size is not too wide apart. The poverty incidence is not also that different. So to make conclusions based on those variables would be not fully supported at this point. I would suggest you reanalyze your data, make the possible matching of the community of the municipality with another municipality, looking at certain not every factor, and then that's you can have a more uh, really case control studies looking at those other variables. So you can only match as with as much number of variables, because if you match too much, baka wala ka nang makita. Pero for an exploratory study, this is a good start. So making the conclusions, as Ding was mentioning, is that all of the municipalities are having all those programs in a way, but at least you have to zero in one rather than just enumerate all the recommendations, which are really being done right now of the municipalities, and really highlight what makes those areas different from the other municipalities. I think that's my suggestion and comments for now.
All
Thank you.
right, thank you, Dr. Huban. I believe other judges still have questions, but let's stick to the mechanics. So we only allow 5 minutes for this portion.
I just
So
placed
again,
it in the
just
chat so that
yes.
it will be noted by the presenter.
Okay. All right. So again, Dr. Miralles, there are additional questions in the chat box, so if you can also answer them. Okay. So reminder again for the judges, so you can ask one question, and for the other judges, if they have other questions, they can also ask a question. All right. Now, our next is a study on fear of COVID-19 and turnover intentions of frontline nurses in the community, a cross-sectional study in the Philippines by Dr. Janet Alexis A. de los Santos of Visayas State University.
Good day, everyone. My name is Janet Alexis A. de los Santos, an Associate Professor of the Visayas State University College of Nursing. I am a nurse by profession, a researcher for several years now, and have been active in writing and publication in various peer-reviewed international journals indexed in Scopus and Web of Science. I am here to present our latest study entitled Fear of COVID-19 and Turnover Intentions of Frontline Nurses in the Community, a cross-sectional study in the Philippines. On this study, I worked with Dr. Leodoro Labrague, also a distinguished author of highly cited articles in nursing. He is a Filipino nurse academician based in Sultan Qaboos University, Oman.
What? Be careful.
We initiated this project with the thought that the current situation of COVID-19 pandemic has caused considerable challenges to the healthcare professionals, most especially the nurses who are providing direct patient care. COVID-19, however, is a unique health problem where even those who are not infirmed, such as the asymptomatic and are out in public, are potential sources in the spread of the virus. This is a non-funded project and is part of a large study assessing the impact of COVID-19 to our nurses. When we did our literature review, we found that most of the published studies tackled more on the situation and welfare of nurses in hospital setting. Very little attention was directed toward frontline nurses in the community. As a response to this, we conducted a project to provide a lens on the situation of nurses in the community, especially those in the rural areas. Esguerra reported that in the Philippines, as of June 22, 2020, there are 3,122 COVID-19 confirmed cases coming from health workers composed mainly of nurses. With the increasing death toll of health workers caring for patients with COVID-19 are the psychological challenges. It cannot be denied that the uncertainty and discomfort in this new normal may pose a further threat to healthcare professionals' work outcomes and psychological well-being. Nurses are placed in stressful situations, fulfilling their roles in the front line while risking their lives to save others. They think about their families back home, aside from them worrying on the risk of contracting the virus themselves. They feel confused because of the rapidly changing protocols, and most often they worry on their need for PPEs. They feel tired and exhausted because of work assignment adjustments and extended duty hours, and they also worry about being understaffed. They are torn because this is the call of their profession, and sometimes they would just think, should I just quit? So for this project, our objective is to assess the fear of COVID-19, psychological distress, and the turnover intentions of our nurses deployed in the community. This study utilized a descriptive cross-sectional design. We were able to get 385 nurses, or 91% response rate from our 400 target. This study was conducted between the months of May to August 2020. Because of border constraints and quarantine protocols, we thought of contacting nurse partners who can help us in the gathering of data. The data gathering was done in several municipalities in the Samar Island. We printed questionnaires to facilitate in the collection. The instrument is composed of 4 self-report questionnaires, including Fear of COVID-19 Scale by Ahorso et al. 2020, the Job Satisfaction Scale by Sharasham and Sui 1980, the Job Stress Scale by House and Rizzo 1970, and lastly, the Turnover Intention Scales. For this variable, we measured using a single item question to assess each of the turnover intention. We identified two variables under this category in order to assess whether the turnover intention is related to the organization they belong or to the profession of nursing or both. Our findings suggest that the mean age of the nurse participants is 32.65 years old. They are composed mainly of females, married, and have completed their BS nursing degrees. Most of these nurses are in active full-time service within the past 7 years. Looking closer to the mean scores of the key variables of the study, we found that the nurses have moderate fear of the virus since most of their scores summed up high above midpoint in our analysis. Nurses in the field display moderate fear of COVID-19 even when caring for asymptomatic to mild cases. This suggests that fear of COVID-19 is universal to all nurses. Similarly, we found that these nurses are in mentally distraught disposition based on the mean scores above midpoint when assessed for psychological distress. The rapidly increasing number of COVID-19 cases from local returnees coming from endemic areas, as well as the regularly changing quarantine protocols, the lack of established health information, longer work hours, laborious contact tracing, and depleted supplies of personal protective equipment physically and emotionally exhaust community nurses, increasing their fear of contracting COVID-19. To a greater extent, these nurses also share the burden with other human resource workers in a multi-sectoral approach to control community outbreaks in the country. Assessing their turnover intentions, we found that these nurses feel and think about leaving the current organization they are in, and not only that, the mean score in the professional turnover intention tells us that these nurses are thinking of leaving the profession of nursing. When asked of their health situation, we found that most of them considers themselves to be in adequate health position. Finally, we found that most of them feels fulfilled and satisfied with the jobs they do in this time of pandemic. Bivariate analysis was used to examine the correlations between the nurses' profiles, fear of COVID-19, and psychological well-being, as well as their turnover intentions. We analyzed the correlation of these variables and found that most of the profiles of these nurses, the female gender is strongly correlated to the fear of COVID-19. This depicts that female gender display more fear when compared to male nurses. Our findings is related to reports which found the female nurses tend to be extra cautious with infection control practices, especially when caring for patients with infectious disease, because of perceived vulnerability to infection and as a precaution to avoid infecting their families. Likewise, we also found that their fear of the virus is related to their psychological distress. The scarcity of literature on nurses in the community setting in this time of COVID-19 hinders us from comparing our findings. Nevertheless, psychological distress is common among nurses treating cases of COVID-19, such that in the case of community nurses in this study, anxiety, fear of getting infected, and social isolation are the dominant psychological stressors. Fear of COVID-19 is likewise associated to the nurses' intention to leave the organization they are currently in, as well as it is also correlated to their intention to quit the nursing profession. As we assessed more closely on the relationship of the key variables, we found after running a regression analysis that fear of COVID-19 influences the nurses' psychological distress and both of their professional and organizational turnover intention. After controlling the nurses' profile variables such as age, marital status, education, years in nursing, years in the organization and job role, an increased level of fear of COVID-19 is associated with increased psychological distress, as well as it is related to increase their organizational and professional turnover intentions. Based on our findings, we arrived to these conclusions. Fear of COVID-19 is common to all nurses, with female nurses appearing to be more fearful than men. When nurses feel insecure and fearful of the virus, they become psychologically disturbed, and the more they express their desire to leave their jobs and quit their profession as nurses. Recommendations. First is to provide nurses with assurance, comfort, and mental health. There is a need to increase capacity building to boost issues on caring and patient management incapacity, institute psychological support services, and stress reduction. Exercise activities may also be initiated by their colleagues. Providing their basic needs of health, safety during isolation and quarantine, and implementing more rest and relaxation activities are strategies that organizations can consider to reduce the worries, anxieties, and fears of these nurses. In this time where social isolation is the new normal, online support through telehealth is imperative to provide psychological support to these nurses, especially when face to face is not possible. Ultimately, it is also a priority to ascertain and explore the real causes of fear and psychological distress to address these issues better and avoid turnover intention. Thank you very much for listening.
Thank you, Dr. De Los Santos. Now it's time for our Board of Judges to give you their question. Thank you. Men who would be asking the question?
Okay, I'll ask first na lang. Akala ko si Dr. Hu ba na mauuna.
Exactly.
I just have really more of two comments and a question, but I think hindi pa naman to published, no? This isn't published yet, no?
It's not yet published,
Yeah,
sir,
because
but I've forwarded it already.
I think means is inappropriate for the analysis kasi you used you used a scale na you have rating scale na 1 to 5. So actually dapat median dapat ang gagamitin, and for that matter if you're going to do any statistics it should be non-parametric or using tests for categorical values. So that's one. And then I think your manuscript will improve immensely if you use the strobe checklist. I don't remember if you attended my my workshop before on
Yes, Doc, I am familiar with strobe po.
Also strobe.
Yes, Doc.
Kasi strobe will also require that you talk about the limitations and possible sources of bias in your reporting, which you did not report in the manuscript. But my bigger concern is that there's no mention in your manuscript that this underwent ethics review and approval. I know there was an ethical section in your manuscript, but It just says that you assure the study adhered to basic ethical protocols, and there was no, how do you say, oversight of an ethics committee. But if there is, I think it should be stated.
Yes, sir.
Because
Sige,
go
sir.
ahead. Sige, go ahead.
Okay. We forwarded this and have this checked with the Summer State University ethics committee. We were able to get a clearance from them.
Okay. So it's very important that that's written down. Kasi kung hindi maka-question ka. But my bigger question is that your study picked up a lot of nurses who had psychological distress. And as a researcher, you have this obligation to see to it that they get some form of help. No, you cannot just do a study, take note of the distress, and then leave them and say, thank you for your cooperation. So,
Yes, sir.
So did they get any sort of referral for care?
Actually, sir, when we gathered our data, we ensured that it is after their psychological first aid. So the nurses who helped us in the gathering of the data from these nurses had a session first with psychological first aid. That's why we were thinking that it could possibly have affected their fear, but our results show that still there is moderate fear despite of the psychological first aid that they received.
So would that, now that I know that detail of the methodology, wouldn't that have changed the results of your study kung na first aid na sila?
Yun na nga, sir. We were expecting a change, but unfortunately, still this probably because it was just one session.
No, what I mean to say is that since they were already debriefed, then wouldn't this be an underestimate of the actual situation?
What do you mean, sir, underestimate?
Had they not received first aid, you might have seen more distress,
yes,
more organizational turnover, more professional turnover intention,
yes,
more poorer job satisfaction, but you already did an intervention.
That was not part actually of our study.
I understand.
Yes, sir. Yun na nga, what we were expecting was kumbaga, lesser fear, lesser turnover intentions because of the PFA. However, in spite of being given that intervention, still there is a high fear, moderate fear rather, high turnover intentions.
I might be taking up the time too much, but my feeling is since they had received some form of intervention, your results might have been higher had they not received the intervention. But anyway,
yes, sir. I would have to agree with that comment, sir. But we are after also on the psychological well-being of our nurses, and that's what you have said earlier. Dapat may intervention, and so that's why we conducted the gathering of the data together, at least with a PFA, so that whatever will be the result, kumbaga may na sila, they are intervened.
Perhaps the intervention should have happened after, but never mind.
Yeah, I think I agree with Jojo on that aspect. Since you did the intention was really there, not to add more agitation on the nurses, but it's wise to state that you had a preliminary intervention prior to getting, because it gives you an idea that. But the other side is that you did not do a baseline before you did the intervention. So I think that's what the parents driving into. It's okay that you did the intervention, but since it was done before, so it is something, the state plus the intervention, you still have a moderate amount of anxiety. And I've known nurses who quit already their jobs in PGH as well. So
yes, that is why
I can relate to your topic, and we have been talking COVID since May, June, July, August, and Jojo is part of many groups working on the COVID research, and one of them is about this. the healthcare worker. Thank you.
Okay, thank you, sir.
Ma'am Janet, can I ask a question?
Yes, sir.
April? Last question na lang. What's your justification for selecting Samar province as the study site instead of
Kasi
other areas in Region 8?
Yes, sir. We wanted to have it in Samar region because, area rather, for the purpose that we wanted to assess the rural areas. Kasi medyo far na siya from the regional office. We are presuming lesser. We have this assumption that they receive lesser PP delivery of their basic needs, sir.
Thank you, thank you.
All right, thank you, Dr. De Los Santos and our Board of Judges. Oh, by the way, before we move on to the next presenter, we encourage everyone to rename your Zoom name to show the institution you are representing. So it should be the name of your institution followed by your complete name. Okay, so our second to the last presenter under professional category is Dr. Steve Paulo Bobon of Eastern Visayas Regional Medical Center, who will be presenting his study on impact of both diabetes mellitus and smoking on treatment outcomes among multi-drug resistant tuberculosis patients enrolled in the programmatic management of drug-resistant tuberculosis.
And I am here to present about the impact of both diabetes mellitus and smoking on the treatment outcomes among MDR-TB patients enrolled in the PMDT unit in Palo, Leyte. TB is one of the ancient diseases that's still affecting us today. One problem encountered is the development of multi-drug resistance. The Philippines is ranked 4th among 27 high-burden MDR-TB countries that accounted for 90% of the global burden of MDR-TB. The common risk factor in the development of MDR-TB is a previous TB disease and treatment. However, there is an increased trend for those who are more than 40 years old, unemployed, lacks health insurance, smear positive, non-completion and failure of TB treatment, adverse drug reactions, non-adherence, HIV positivity, COPD, and diabetes mellitus. In the Philippines, no patient factors and clinical factors was associated with successful treatment outcomes. It was noted, however, that individualized regimens have more chance of successful treatment as compared to standard regimens. Women also considered to be cured more than men, and personal factors associated with loss to follow-up are the following: age more than 40 years old, tobacco smoking, alcohol abuse, and residence in urban slum. According to Samuel Sod, Campbell, Kahn, and Johnston stated that people living with HIV and people with alcohol misuse have more unsuccessful treatment outcomes. It was similar in patients with diabetes or in smokers. Thus, this study focused on the additive effect of diabetes and smoking and its influence on the treatment outcomes of MDR-T patients, so that we will be able to recommend and design strategic interventions for these high-risk groups. The significance of the study can be divided into two. For the clinicians, it can contribute to the advancement of knowledge on the PTB, and it can also add information on the characteristics of disease pattern. For the government, it can create additional opportunities in identifying possible targets for the success of the TB eradication program. It can also help government to establish diabetic smokers as special population with high risk or those who have special needs, and it can also help in imposing stricter rules on cigarette smoking in our country. Our study only limits on the effect of both diabetes and smoking on the treatment outcomes. Our data was limited only to the charts that were reviewed on the patients that were enrolled in the PMDT unit. There are many factors associated with the development of MDR-TB. One is age and sex, with age more than 40 years old and women, and the presence of cavitations on chest X-ray. Also, being positive for MDR-TB and XDR-TB have more unsuccessful treatment outcomes. Those who are residing in urban slum, unemployed, homeless, and imprisoned have more unsuccessful treatment outcomes as compared to those who are not. HIV infections, alcohol abuse, and diabetes mellitus are, are indicated for more unsuccessful treatment outcomes. However, for diabetes mellitus, the result is uh, not that sure. And in India, Egypt, and China, it was associated with treatment failure. However, systematic review and meta-analysis showed that there was no association with treatment outcomes. Drug abuse and smoking and extrapulmonary disease and disseminated disease are more prone to be unsuccessful as compared to those who are not. Patients who have resistance to isoniazid, rifampicin, and at least one of the secondary line agents and isombutyl or septomycin have more mortality risk versus those who are resistant to isoniazid and rifampicin only. And also, the sputum conversion can also affect the treatment outcomes. Adverse drug reaction can be associated with loss to follow-up, with vomiting as the main indicator. And patients who are receiving assistance from the TB program are more likely to have successful treatment outcomes. Thus, our population includes those who are MDR-TB patients, either they are diabetic non-smoker, diabetic smoker, non-diabetic non-smoker, and non-diabetic and smoker. Then they will be subjected to the MDR-TB regimen and with the outcomes either successful or unsuccessful treatment outcome. For definition of terms, the diabetes mellitus refers to patient those that are diabetic. MDR-TB patients refers to infection with MDR-TB with TB with resistance to at least any of the first line of treatment. New case refers to contacts of confirmed DRTB cases, non-converters of category 1, person living with HIV with signs and symptoms of TB, or as indicated. Retreatment refers to cases of relapse, treatment failure, loss to follow-up, previous treatment outcome unknown, among others. Smoker refers to patient who smokes. Diabetic smoker refers to a diabetic patient who smokes. Diabetic non-smoker refers to a diabetic patient who does not smoke. Non-diabetic smoker refers to a non-diabetic who smokes, and non-diabetic non-smoker refers to a non-diabetic who does not smoke. For treatment outcomes, cured meaning patient had completed at least 18 months of treatment without evidence of failure, and 3 or more consecutive negative cultures. Treatment completed means the patient completed at least 18 months of treatment. Loss to follow-up means patient treatment was interrupted for 2 consecutive months or more. They have died from any cause at any point during the treatment. The successful treatment outcome include cured or treatment completed. Unsuccessful treatment outcome include those who are lost to follow-up and died during the treatment outcomes. Age is divided less than or more than 50 years old. Sex, male or female. HIV status means negative or positive for HIV. Alcohol and drug use, whether they took alcohol or drug use during treatment. And for cavitary TB disease, whether they have presence of cavitations in the X-ray. Our general objective is to determine the impact of both diabetes mellitus and smoking on the treatment outcomes, with specific objectives on the portion of diabetic smokers, diabetic non-smokers, non-diabetic smokers, and non-diabetic non-smokers among MDR-TB patients. To determine whether the association between diabetes and being smoker with unsuccessful treatment outcomes. For the methodology, this is a cross-sectional analytic study, and patients who are bacteriologically confirmed and enrolled at PMDT and at least 19 years old were included in the study. Data recording was used using a data collection form and encoded in a Microsoft Excel using coding manual. For the results, Table 1 showed that 13.1% of the patients were diabetic. Only 40% are non-diabetic and non-smokers. For Table 2 showed that majority of the patients are less than 50 years old and majority of these patients are males. And 98.4% of these are HIV negative, 38.2 of cavitary lung disease, 86.9% are retreatment cases. Table 3 showed that 33.51% of the successful outcomes were smokers but non-diabetic. Diabetic patients who had unsuccessful treatment is the lowest, with diabetic smoker at 1.57%, diabetic non-smoker at 2.62%. Table 4 showed that diabetes nor smoking has no significant overall effect. However, being a new MDR-TB case is associated with increased odds of achieving a more successful clinical outcomes. Less than 50 years old are half the time more likely than those older patients to achieve successful clinical outcome. In summary, majority of the patients are not diabetic. Among diabetic, only 4.7% are smokers. 35% of the patients are non-diabetic and non-smoker. Majority of the patients were less than 50 years old and mostly were males. Almost half admitted to have history of drinking alcohol beverage and only 2.1% had illicit drug use. 86.9% are retreatment, 13.1 are new cases, 61.8% did not show cavitations on their X-ray report, and 61.26 had successful treatment outcomes. For the conclusion, diabetes and smoking have no direct impact on the treatment outcomes. MDR-TB classification and age were found to have some degree of association. Thus, increasing vigilance in locating patients or those to follow up. New TB patients should be educated repeatedly on the importance about staying in the treatment regimen, and TB patients required to attend health education. Thank you.
Thank you, Mr. Bowen. Okay, so our Board of Judges, please provide your question or give out your question, please.
April, let me ask the first question.
Okay, go ahead, Sir Dean.
Okay, thank you very much, Doctor, for your research. In the paper that you submitted, you mentioned in the inclusion criteria, immediate family member of enrolled MDR-TB patient with first-hand knowledge of the patient health status as one of the inclusion criteria. Why did you think you have to include this item when in fact you were only collecting the records review in your data collection?
Actually,
What do you mean by this immediate member of the family with first-hand information?
sir, it's more on the source of the history for the patient. The source of the history was written on some charts. So majority of these were the immediate family members of the patients. That's why they were included.
But the but the mem- but the caregivers or family members information usually do not appear in patient's chart. I'm just curious if you conducted an interview among the caregiver or caretaker of the MDR-TB patients. Did you conduct interview?
No, sir. It was purely a chart review.
Okay. Sige. One last question. Did you comply Data Privacy Act in your data collection because you were able to collect data from on MDR-TB, which are very sensitive information, and then you were able also to determine 3 patients which were HIV positive. How did you comply the Data Privacy Act law?
Actually, sir, we applied for coding, so we don't really have the actual data. So we just input numbers for this patients.
But the data provider provided you with the names or not?
Yes, sir. For the purpose of pulling out the charts to be reviewed.
Okay, that's all. Thank you.
Okay. Okay. Can I ask a question?
Go ahead, Doctor.
Yes, po, sir.
Yes. So your objective was to find out what the outcomes were among those with smoking, diabetes, and both smoking and diabetes. Ang question ko sa iyo is more of a theoretical question. But what's the best study design if that's your objective?
Actually, for this type of study, I think it will be not a retrospective, but more on prospective study.
Yeah, I agree with you. No? Actually, the answer is it should be a cohort study.
Yes.
Knowing that it's very difficult to come up with a cohort and wait for them to develop a cohort of those with MDR-TB who have diabetes and smoking, and to wait for their outcomes. What would be a second best study design for this? Pagka ganyan.
I'm sorry, sir. I can't think of anything.
Well, the answer is case control. And I think kasi retrospective rin kasi ang case control. But you get those with the bad outcomes, and you get they're what you will refer to as the cases, and those who didn't have a bad outcome, those are your controls. And then babalikan mo yung chart to find out yung exposure nila, which is the smoking and the diabetes. I think that would have been a better study design with the same effort because it's still chart review, no? So yun lang ang comment ko. Parang cross-sectional lang ginawa mo. And I don't know if you have, that's why ang liliit ng ano mo ng cells mo Diba? In your overall result, ang konti lang na may diabetic na smoker, na diabetic na non-smoker, gano'n. Siyempre, pinakamarami yun, non-diabetic smoker and yung non-diabetic non-smoker. So it would probably have been better to start with the outcome of interest and then go back para yung frequencies mo o yung mga ads mo ay mas malalaki. That's just a suggestion. I'm not sure. Submitted na ba to? Baka pwede pang i-revise? I don't know. Anyway, that's my comment. That's my general. And
okay, so thank you.
Again, no, my advocacy with ethics. Kahit retrospective to, dapat dumadaan sa ethics committee, and I didn't see anything in your manuscript na dumaan to sa ethics committee. Kasi as Ding has said, no, as Dr. Olobia has said, no, yung privacy, you're looking at sensitive information, HIV status, mga ganyan. But yan. Okay, that ends my comments.
Okay, so thank you.
All right, so you're just on time, Dr. Mantaring. Okay, so
May simbahan na malapit dyan.
Okay, so to wrap up the presentation for this category, we have Mr. Jefferson E. Flores of Leyte Normal University to present his paper on ingestion of microplastic by zooplankton in San Pedro Bay, Leyte.
Good day, everyone. I'm Jefferson Flores from Leyte Normal University, and I will be presenting our study entitled Ingestion of Microplastic by Zooplankton in San Pedro Bay, Leyte. But before I move to the key points of our study, let me introduce other members of the team who worked on this. Pauline Christine Baronda, Karil Ann Isito, and Erwin Urbano. Again, the title of our research is Ingestion of Microplastic by Zooplankton in San Pedro Bay, Leyte. Let me begin with plastic. Plastic has been considered as a miracle material. Miracle in the sense that it has made our lives convenient. But beyond the convenience plastic offered us is a problem that many of us failed to see. Most of it are used just once, and they're choking our waterways. Over the past 60 years, there has been a rapid increase in plastic production, and in 2012 alone, there's an estimated 288 million tons of plastic produced globally. Previous studies have even implicated the Philippines as one of the highest contributors of plastic, which eventually land to our bodies of water, especially our Earth's oceans. With the Philippines hosting a very high marine biodiversity, the interaction between marine species and these marine pollutants become inevitable. Sadly, reports reveal that many species have already succumbed to these marine pollutants, and the number is expected to rise, given that the research on this topic is also expected to increase. In recent years, there has been much attention paid to a category of plastic called microplastic. Literally, these plastic particles are very small. Microplastics have been an emerging contaminant of concern due to their global abundance and widespread distribution. Just an overview of microplastic, they can be categorized into two: primary and secondary microplastic. Primary microplastic are microplastics that are designed to be very small. These are used in facial cleansers and in cosmetic products. While secondary microplastics are very small plastic particles that were products of degradation of bigger plastics. Again, if they're intentionally made very small, they're primary microplastic. But if they're products of degradation of bigger plastic, they're secondary microplastic. Now, the concern here is that microplastic can be ingested by a range of microorganisms, including fish, seabirds, and benthic invertebrates. Furthermore, microplastics can bioaccumulate within the food chain, evidenced by trophic transfer of microplastic between mussels and crabs and fish, and most probably to humans. Current evidences indicate that the consumption of microplastic may result in gut blockage, translocation, heightened immunological response, and depleting energetic reserves. In reviewing the existing literature, it's evident that the impact of microplastic on animals at the base of the marine food web is under-researched. Also, records related to microplastic and microplastic ingestion by several marine organisms exist on the international scope, yet little is known about the phenomenon in the Philippine waters. This seemingly little information about microplastic ingestion prompted the researchers to do this study. And we focused on zooplankton because of the identified presence of zooplankton, specifically Calanoida and Tintinida, in the waters in the region, specifically in San Pedro Bay, Leyte. And this is in the study of Likayan 2014. The main objective of this study was to examine the ingestion of microplastic by two orders of zooplankton, Calanoida and Tintinida, present in San Pedro Bay, Leyte. More specifically, we wanted to identify the type of microplastic present in the seawater samples from San Pedro Bay and determine the quantity and type of microplastic ingested by zooplankton. This study is a descriptive one, since we only wanted to determine the type of microplastic present in the seawater samples from San Pedro Bay and determine the type and the quantity of microplastic ingested by zooplankton. This study was conducted in San Pedro Bay, which is in between the islands of Samar and Leyte. More specifically, we identified 4 sampling sites, part of the San Pedro Bay, Leyte, specifically in Anibong, Tacloban City, in Candahug, Palo, Leyte, in Santa Rita, Samar, and in Marabot, Samar. In each sampling site, we were able to identify 2 sampling stations. One which is 50 meters away from the shore, and one which is 100 meters away from the shore. So for example, in Anibong, we have 2 sampling stations, 50 meters away and 100 meters away. These sampling sites were identified because they were near local establishments as well as communities and residential areas. This illustration summarizes what we did in our study. We began with collection of water samples. The water collected made it possible for us to be able to determine the microplastic present on it and isolate zooplankton and identify them. So we began with the identification of zooplankton present, and we were guided by an expert in the field. And then after we were able to identify that the zooplankton present were calanoida and tintinida, we had them preserved and we had them undergo acid digestion. The purpose of acid digestion is to destroy biological materials and then examine the more recalcitrant ones for microplastic particles. And then we went on to examine other samples, water samples, to determine the type of microplastic present. The method used for collection of water samples was volume reduced method adapted from Hidalgo, Rose, Guteau, Thompson, and Thiel 2012, and the zooplankton collection method was from Moncada 2014. Also, the sieving and the sorting procedures for the water samples was based on the studies of Carson and Rocco 2005, and identification of microplastic was based on the studies of Hidalgo, Ruz et al. And Lauder George. This is the result of our study. This particular table answers our first question, which is to determine the type of microplastic present in the samples, in the water samples in San Pedro Bay, Leyte. Surprisingly, there was no primary plastic present in the samples in San Pedro Bay, Leyte, all of which were secondary microplastic. And in the data on the table, it's Candahug, Palo, Leyte, which had the most number of secondary microplastic. This table shows the number of microplastic ingested by the zooplankton calanoida. Now, since the earlier table revealed that there was no primary microplastic in the seawater samples of San Pedro Bay, Leyte, all of the microplastic identified to be ingested by calanoida were all of secondary type. Now, based on the data on the table, most microplastic were identified from calanoids in 50 meters away from the shore than in 100 meters away from the shore. This goes to show that more microplastic of secondary natures are found near the shore than that of areas farther from the shore. Tintinnids show no ingested microplastic particles. This result is backed up by other studies showing the same result for tintinnids. Now, to sum everything up, this study was able to identify and determine that indeed microplastic particles are present in San Pedro Bay, Leyte. And all the microplastic determined in the study were all of secondary type. That means these are microplastics which resulted from the degradation of bigger plastic. And only zooplankton of the order Calanoida had observed ingestion. Now, the researchers recommend that a more sophisticated observation methodology will be used in the next studies. Also, researchers should consider the temporal factors, and the addition of more sampling site should be considered as well. Now, the area of microplastic research has become known and has grown rapidly in the last decade as microplastic gained recognition as an emergent issue of international concern. There is a recognized need for the harmonization of microplastic field technique, data collection, laboratory analysis, and data reporting, since in the survey of literature, there were different methods to identify microplastic ingested by several microorganisms and organisms in the marine environment. Also, studies like this is an addition to the call for the strict implementation of laws regarding the use of plastic and laws related to protection of the world's bodies of water. That's all for our study. Thank you for listening.
All right, thank you. Now, can we call one of the judges to give the presenter the question?
Can I have the floor, April?
Okay, yes, go ahead, Sir Dean.
Okay. Thank you very much, Mr. Presenter, for your study. I'm just particularly concerned about the social value of your research, because in epidemiological research, you usually determine exposure and the outcome, which is usually the disease. I just have two questions. In your literature review, did you encounter literatures really mentioning diseases when you are consuming microplastics or zooplankton with microplastics? And another question is, what is really the social value of your research? Hello, April?
Let me just check. Mr. Flores was actually here earlier. Oh, I think he got disconnected. Um, should we wait for him to reconnect?
Mhm.
I think he's still trying to get back. Let me just check.
Kung medyo magtatagal, di punta na lang tayo sa iba.
Ay, wala nang presenters eh.
Oh, okay.
Wala
I
na
think
ba?
one from their institution says that he is trying to reconnect now. So let's just give him a few,
Oh.
probably few seconds to do that before we move on to the next part of the program. He said that they're having intermittent connectivity in their institution. So,
Sagutin na lang niya sa chat. Ano yung meron ba siyang ano yung health effects pag kumain ka ng isda na mayroong microplastics? At saka yung what's really the social value of the study? Pwede na sa chat kung walang kung walang
okay, while waiting for Mr. Flores to get connected, is it okay if we take first our picture just for documentation purposes?
yeah, sure.
Sure. Okay, so may I request everybody to please turn on your videos and show us your most beautiful smile.
Sure.
You have to remove your mask, Sardine.
Yes. Okay, just give me a few seconds to do that.
Si Doc po ba nakaano tayo?
All right, so in a count of one. Okay, Ma'am Annie, please turn on your camera.
Shy si Annie, shy.
Ay, yo. Anisha, nasan ka?
Okay lang, wala siguro.
Okay, so in a count of three, I'll take the picture. Okay, 1, 2, 3. Just give me a second here.
Okay na?
Next batch, please. Okay, hold on.
Next batch.
Because we have actually, a lot of participants. So again, thank you for our participants from different institutions. Okay, in a count of 3. 1, 2, 3. Next.
Next, sige, next.
Next, please. This is the last one. All right, 1, 2, 3. All right, so I have already taken all of the pictures. All right. So again, reminding others to please turn off your microphone if you're not asked to speak. Thank you. Let me just go ahead and check if Mr. Flores is now back. I don't think he's back. Oh, I think Mr. Flores is now on. He's using the the account of Miss Joyce Magtolis. So, Mr. Flores, are you ready to answer the question? Sardine, can you please repeat your question?
Yeah. Okay. So, Mr. Flores, thank you very much for your time and your research. I was just wondering, in your review of literature, did you encounter studies that mentions the that when you consume microplanktons, you will develop some diseases? And then another question is, what is really the social value of your research?
Okay, sir, to answer the first question, the topic right now remains under-researched, and researchers similar to this are always recommending to explore more on diseases, on impact specifically at the human level, because the existing literature right now only focus on organisms like zooplankton. And they found out that at this particular level, microplastic really affect the physiology of zooplanktons and similar organisms at the same level. As to human impact, no study has ever been conducted yet to determine whether microplastic injection by these marine
I'm sorry, Mr. Flores, please turn on your microphone.
Am I audible right now?
Yes, we can hear you again.
Okay. Now to answer the first question,
Yeah. Second question na lang. Kasi I got your answer already.
Okay. This particular study would actually let everyone be informed about their practices, specifically in how they manage wastes like plastic. Now, this study actually proved that because we're not responsible in handling our plastic wastes, these land in bodies of oceans and thereby affecting marine ecosystem. If this is not controlled, this will backfire and everyone gets affected. So I bet this one is something that would enlighten everyone that our practices really affect everyone in the ecosystem. So this is actually one of the major reasons why this study was conducted, to prove that there indeed is an effect of our practices to other organisms.
Okay, thank you.
All right. Thank you, Sir Ding. How about you, Dr. Huban? Do you have a question for the presenter, Dr. Bantaring?
Actually, just a comment that there are reporting standards for environmental studies, but of course, this cannot be found in the. So you probably headings of what to report for environmental studies such as.
Okay.
All right. How about Dr. Huban?
I go with the comment of Ding. Hopefully, he can relate it to health and to food consumption, and he answered it with in the last section on the last on his last statements, but I think he should highlight it more, since this is a health research consortium, and yeah, we value also the inputs from the basic researches and how in the future or how we see it affects our lives as well. So it's just you have to link the basic research to health. It's not some when you do your presentation for your in such a contest like this. That's only my comment. Thank you.
All right, thank you. All right, thank you, Dr. Huban and the rest of the Board of Judges. So connectivity issues are really something inevitable. So we're so glad that naitawid mo din siya, sir. Okay. All right, so and that ends the oral presentations for the professional category. Again, congratulations, presenters. So how's everyone doing? Yeah, I know how a video conference can sometimes be, energy draining. So let me do some type of check in with you guys. Can you show me a virtual thumbs up if you're still feeling okay? Let me see if you're still okay. So please, show me a virtual thumbs up if you see that it's located on the lower right corner of your screen. Okay, all right, great. It seems like everyone is now ready for the next part of this event. So, without further ado, let's move on to the next set of contenders under student category. Again, we will be following the same mechanics for the student category. A 5-minute question and answer session will follow the presentation, and the judges may ask one or more questions to the presenter within the 5-minute period. A buzzer will be heard once the 5 minutes period is over. Okay, so our first presenter is from the University of the Philippines Manila School of Health Sciences, who will be presenting their study entitled A Comparative Study on the Compliance in Maternal and Child Healthcare Services among 4Ps and non-4Ps mothers in Tanawan, Leyte.
A pleasant morning to all. Our research paper is entitled A Comparative Study on the Compliance in Maternal and Child Health Care Services among 4Ps and non-4Ps mothers in Tanawan, Leyte. Over the past few decades in the Philippines, the topic of health has become increasingly important. In order to strengthen its health system, the country has initiated multiple reform rounds. To determine the association between the compliance or non-compliance with the maternal and child health care services and each of the profile variates of the 4Ps and non-4Ps mothers, the researchers utilize a descriptive method. 150 4Ps and 150 non-4Ps mothers were selected through multi-stage systematic sampling method. Frequency and percentages was used to determine the demographic profile of the respondents. The study reveals that there is no significant association between the compliance or non-compliance in maternal and child health care services of 4Ps and non-4Ps in relation with the prenatal visit, place of delivery, deliveries handled by skilled health professional, postnatal visits, and immunization. However, the researchers found out that there is a significant association between the type of compliance and nutritional assessment, as well as family planning variables, which rejects the null hypothesis. Objectives of the project. This research aims to determine the compliance on maternal and child health care services among 4Ps and non-4Ps mothers in 5 barangays of the municipality of Tanawan, Leyte. Specifically, the research would like to address the following objectives. 1. What is the respondent's demographic profile based on their age and educational attainment? 2. To describe if 4Ps members aging 25 to 49 years old mothers are more compliant than to non-4Ps in terms of prenatal services, deliveries in health facility, deliveries attended by skilled health professional, postpartum checkup with postnatal care of her newborn, family planning services. 3. To describe if mothers with children aging 0 to 5 years old under the 4Ps program are more compliant than non-4Ps in terms of receiving regular health services such as immunization and nutritional assessment. 4. To determine the significant association between the compliance or non-compliance in maternal and child health care services between 4Ps and non-4Ps mothers. Methodology. This study utilized a descriptive research design It uses a researcher-made questionnaire. It will also describe the compliance among 4Ps and non-4Ps mothers. Further, the design will be employed to describe the profile of the respondents on the variables being tested and determine the association between the compliance and non-compliance among 4Ps beneficiaries and non-4Ps mothers in utilizing maternal and child health care services. The research paper utilizes a multi-stage systematic sampling design with 4 stages. First stage was the arbitrary selection of the municipality of Tanawan Leyte. Second stage was the random selection of the barangay. Third stage was the identification of 4Ps and non-4Ps mothers who gave birth for the past 5 years from the randomly selected barangays. Last stage was the identification of the sample size. Eventually, 150 4Ps and 150 non-4Ps mothers were selected in the study. Data analysis. The researchers utilized a chi-square test. The data will be summarized in tables. It described the demographic profiles such as age and educational attainment, which will be tabulated according to their frequencies and percentages. It will also describe the compliance in maternal and child health care services such as prenatal checkup, deliveries in health facility, deliveries handled by skilled health professionals, postpartum checkup with postnatal care of a newborn, family planning, and nutritional assessment. The results of this presentation is mainly on the salient findings of the research. Table 6. Out of 150 4Ps member respondents, only 40 or 26.67% were compliant of maternal services in terms of postpartum visits, whereas 110 or 73.34% were non-compliant. The data suggested that majority of the 4Ps member respondents were not compliant of postpartum visits. The finding is contrary to the provision of the Republic Act No. 11310 on 4Ps, which states that all qualified household beneficiaries, especially mothers, have to comply with postpartum care as a requirement for continued program eligibility. Hence, this meant that eligibility of the majority of the 4Ps members of this study might be questioned because of the non-compliance of postpartum care. The findings of the study indicated that most of the 4Ps members were compliant of the family planning efforts of the Philippine government. However, the data in Table 7 revealed that 81 or 54% of the non-4Ps members were non-compliant of the family planning efforts of the government, with only 69 or 46% of the non-4Ps members who were compliant. This meant that most of the non-4Ps members were not compliant of the family planning services provided by the government. In summary, the 4Ps and non-4Ps members had complied with almost all the parameters of maternal and child care services except as regards with family planning, to which 4Ps members were more compliant than the non-4Ps members. However, both 4Ps and non-4Ps mothers are not compliant in utilizing postnatal services provided by the government and under the RA 11310. Association between type of compliance of the 4Ps and non-4Ps members and parameters of the maternal and child health care services. In Table 14, it shows that the association between the type of the compliance and family planning services was high, implying that there is a significant association between the type of compliance and family planning. Therefore, we reject the null hypothesis. Type of compliance and family planning are independent, and we accept the alternative hypothesis that type of compliance and family planning are not independent. Type of compliance and nutritional assessment. Table 16 shows that the association between type of compliance and nutritional assessment was high, implying that there is a significant association between the type of compliance and nutritional assessment. Based on the presented facts and findings of this study, the researchers arrived at the following conclusions. First, the socio-demographic profile among 4Ps and non-4Ps mothers, like age and educational attainment, affect their utilization in the maternal and child health care services provided to them. Second, except with postnatal visit, 4Ps mothers are compliant in all variables. However, Non-4Ps mothers are not compliant both with postnatal visit and family planning. Third, aside from family planning and nutritional assessment, there is no significant association between compliance or non-compliance with the maternal and child health services, and each varies of 4Ps and non-4Ps mothers. Fourth, the data also showed that implementation of Republic Act 11310, or also known as Pantawid Pamilyang Pilipino program, was successful and effective to the 4Ps member beneficiaries. Recommendation. This study revealed that 4Ps and non-4Ps mothers are not compliant in terms of postpartum checkup and postnatal visit in the selected barangays of Tanawan Leyte. The result implied that, despite of the implementation of the Republic Act number 11310 on 4Ps mothers, which states that all qualified member beneficiaries, especially mothers, have to comply with postpartum care as a requirement for continued program eligibility, is not utilized by the members of the program. However, the results also showed that non-4Ps mothers are not compliant in utilizing family planning services. Hence, the researchers recommend that the Department of Social Welfare and Development should strengthen its guidelines on monitoring the beneficiaries in complying and abiding the law being implemented. Another recommendation wherein healthcare providers should also employ more intensive demand generation strategies which shall focus on increasing knowledge of the 4Ps beneficiaries as well as non-4Ps mothers on the advantages of availing postpartum checkup to prevent further maternal health problems and strengthen family planning counseling not only for 4Ps members but also to non-4Ps mothers to ensure successful execution of the program and increase the compliance in utilizing maternal and child health care services, and also to have a strict implementation on Republic Act number 11310 on 4Ps member beneficiaries provided by the government.
So that was Miss Eunice Bato. All right, so thank you so much for that presentation. Now let's move on to the question and answer portion. May we have one of the Board of Judges, please? Dr. Huban or any of the judges?
Okay, I can start.
Okay.
Just like to ask, why did they use the word compliance rather than adherence?
Um, we use the compliance because we're trying to look into the availment of the mothers in terms of postpartum care and all the parameters being measured in the research. And we use the compliance since we would like also to look into the association on their compliance of the 4Ps and non-4Ps mothers.
Yeah. Have you encountered the word adherence in terms of your studies so far?
Adherence, yes, sir.
Yeah. Okay. Continue.
Based on the review of related literature, we actually encountered the word adherence, but more of the literature that we have found is they use the word compliant. So we use that instead of using adherence, and it actually helped us in the research in determining both respondents on in terms of maternal child health care.
Yeah, I think the researchers before would like to use compliance, but now I think what is advocating is that in compliance you you comply because there is a rule. In adherence, there is a rule and there is a voluntary thing on the part of in this case, the mothers to adhere to the rule. There's no force, and but there is the self motivation in that aspect. Rather,
Proactive.
it's proactive, as Jojo would.
Okay, sir.
Thank you. And also,
Okay, sir.
I did not
Okay,
see
sir.
any definitions for how do you measure compliance in terms of the different programs. And for example, if a mother has 3 kids and
Okay.
she is bringing the kid 1 regularly and the kid number 2 not regularly, how would you measure how would you categorize the mother? And also, are
Actually,
there
sir.
rules for
Okay, sir.
that one? Yeah.
Okay, sir. Actually, sir, in the research respondents, I actually forgot to put that in the manuscript we had, but on the research paper, we have this the inclusion and exclusion criteria, where in the inclusion, members, mothers only aging 25 to 49 years old are the one being chosen as the respondent, and mothers who have at least one child aging 0 to 5 years old, regardless of the number of children, which means the mother will only be counted as one. So one representative from the child, the mother. That's why if the mother if the mother has three or more children, still the mother will be counted as one.
Yeah, I agree with you on that aspect. But the point
Did I
is,
answer your
if you
question?
have if you have two kids, you are compliant with the care of one kid, and you are not
Okay.
compliant with the care of the other one. How would I categorize you? 50% compliance. So there are things that you have to define when you do, like for example, uh, household studies. When there are, like for example, asking about a care of members of the family, in this case with the kids. So you have to pinpoint whether it's the last kid or all of the kids. So that's one thing, because you will be asked this question: what was your basis? I think that's all. Jo.
My
Okay, thank
question,
you,
well,
sir. Thank you, sir.
again, I cannot help but question my advocacy. But it's important to state in your manuscript about ethical clearance for
We
can be privacy and confidentiality. Anyway, it's not
I
my
think, sir, yes, po, we have this ethical consideration in our paper.
next time, please state it, not only in the paper, but also in the oral presentation. The second is just a comment, but you have so many tables, but they can be collapsed
Okay,
into
sir.
just,
Okay, sir.
you can just collapse that into one table, looking at the 4P in the column and not comparison variables in just one table so that it becomes more concise. Um, my my comment or which I don't know if you might consider it as a question, is that compliance has many components. And my thought is that if both the 4Ps and the non-4Ps don't comply, don't you think that it's a systemic thing? Baka, how can you comply, for example, if there's no doctor? Or how can you comply if di ba? Which might be a more important question. There might be the desire to comply or to adhere, but the situation does not allow them. And that's probably why both the 4Ps and the non-4Ps are unable to comply with the same frequency. Did you look into yeah. Well, I think you need to look into that.
Thank you, sir. Okay,
All
sir.
right,
Thank you.
thank you
Noted
so
po.
much. All right, thank you so much, Miss Beto and the rest of the judges. And now to present extended spectrum beta-lactamase producing gram-negative bacteria among clinical isolates in selected hospitals in Tacloban City, we have Kristen Faith Pulga of Remedios Trinidad Romualdez Medical Foundation, Tacloban City.
A pleasant day to each and everyone. I'm Christine Faith Pulga and I will be presenting our research study about extended spectrum beta-lactamase producing gram-negative bacteria among clinical isolates in selected hospitals in Tacloban City. The primary aim of the study is to determine the prevalence of extended spectrum beta-lactamase or ESBL producing gram-negative bacteria among clinical isolates in selected hospitals in Tacloban City. The study will serve as an eye-opener to the healthcare providers for them to carry out better treatment and management of infectious diseases in response to the threat of proliferation of multi-drug-resistant pathogens. The study will not only be of help to the healthcare providers, but also to the patients and the whole community as well. The emergence and spread of ESBL-producing gram-negative bacteria have increased all over the world, particularly in hospital settings. First reported in Germany in 1983, it is a multi-drug resistant and a rapidly evolving group of beta-lactamases which share the ability to hydrolyze third-generation cephalosporin, leaving only a few reliable therapeutic options to an infection. These organisms are frequently resistant to many of the antimicrobial agents usually recommended for the treatment of infections caused by E. coli or any other gram-negative bacteria, such as penicillin and cephalosporin. According to the study conducted by the group of CDK in 2014, antibiotic resistance among gram-negative bacilli is a rapidly expanding problem due to the organism's ability to mutate and to acquire and transmit plasmids and other mobile genetic elements encoding resistance genes. ESBL-producing Enterobacteriaceae, such as E. coli and Klebsiella pneumoniae, are some of the most common causes of infection, including urinary tract infection, post-operative infection, septicemia, and even nosocomial infection. Extensive use of antibiotics, prolonged hospitalization, indwelling devices, and severe underlying diseases had been factors that led to the spread of ESBLs. One of the most widely prescribed antibiotics worldwide are the beta-lactam antibiotics. These include the penicillin and cephalosporin. This group of antibiotics acts on the cell wall of a bacterial cell that catalyzes the peptidoglycan wall of the bacterium, which results in the weakening of the cell wall structure, leading to cell lysis. However, introduction of this antibacterial agent was immediately accompanied by the emergence of drug-resistant organisms, which adapted different mechanisms to counter the effect of the antibiotics. Problems in ESBLs have led to limited expensive treatment options, difficulty in managing infection, and added constraint on an already overburdened health system in developing countries. With an inadequate database on ESBLs in the Philippines and the limited testing done in most clinical laboratories, the prevalence of ESBLs is most likely underestimated, of which can be a serious outbreak, particularly in immunocompromised individuals. With the aforementioned conditions, the researchers want to evaluate the prevalence of extended-spectrum beta-lactamase producing gram-negative bacteria among clinical isolates in selected hospitals in Tacloban City. The study will act as an eye-opener to the healthcare providers and facilitate them to carry out better treatment strategies. The study will be of help not only to the hospital care providers and patients but to the whole community as well. The general aim of this research is to detect the extended-spectrum beta-lactamase producing gram-negative bacteria among clinical isolates in selected hospitals in Tacloban City. To be specific, the study aimed to determine the ESBL producing gram-negative bacterial isolates through genetic characterization. The study also aimed to compare the prevalence of ESBL producing bacterial isolates received from the clinical laboratory of the selected hospitals based on the two methods, namely phenotypic screening and genotypic screening. Lastly, the study aimed to determine the sensitivity and specificity of the phenotypic characterization of ESBLs compared to the genetic characterization. A cross-sectional research design was utilized in the study. All the identified bacterial isolates that were phenotypically screened for ESBL by the selected hospitals were subcultured into a broth and incubated for 24 hours. After incubation, a stock culture was made by inoculating again the bacteria into another freshly made broth and incubated for 24 hours. After incubation, the broth were added with glycerol and preserved in 1 to 6 degrees Celsius temperature. This is to maintain the viability of the isolates until confirmatory test was done. All the strains that were phenotypically screened positive and negative for ESBL production were subjected to confirmation through molecular testing. Multiplex PCR for TEM, SHV, and CTXM genes was used to detect ESBL genes in bacteria. Before PCR was made, the stock cultures were inoculated into a quadrant plate to ensure the viability of the bacterial isolates. After 24 hours of incubation, a single colony from the plate was inoculated further to a broth and incubated again for 24 hours. This served as the overnight bacterial broth culture for DNA extraction by boiling method. A volume of 200 microliter of the 24-hour incubated culture was used, and the DNA was eluted in a final volume of 50 microliter. The primer pair sequences used, melting temperatures, and amplicon sizes were carefully observed as per manufacturer instructions. The molecular polymerase chain reaction assay was performed using the Kiagan multiplex PCR kit for the simultaneous detection of the SHV, CTXM, and TEM genes. 3 sets of primers specific for these genes were used. The reaction tubes were placed in a PX2 thermocycler with the cycling conditions as follows: denaturation at 94 degrees Celsius for 10 minutes, annealing at 60 degrees Celsius for 1 minute, extension at 72 degrees Celsius for 1 minute, and a final extension step at 72 degrees Celsius for 7 minutes. A 16S DNA was used as a control. The amplicons or products of the PCR reactions were visualized using an ultraviolet light box, following electrophoresis on a 1.5% agarose gel, which contained 11.5 microliter of ethidium bromide. A molecular weight marker was used as a reference. In this study, a total of 18 bacterial isolates were yielded. From these isolates, 9 were obtained from urine sample, 5 from sputum, and 4 from stool. Among these isolates, majority are Escherichia coli, which constitutes 66.7%, and around 33% are Klebsiella species. Presented in Table 4 is the frequency distribution of gram-negative isolates based on the phenotypic ESBL characteristics in relation to the source of specimen. A total of 6 obtained from the E. coli species and 2 from the Klebsiella species that were isolated were phenotypically ESBL producer, resulting to an overall prevalence of around 44%. Presented in Table 5 is the genotypic characterization of which all of the 18 bacterial isolates were subjected to polymerase chain reaction, regardless of their phenotypic results. The overall prevalence of these ESBL genes in this study was 77.7%, which constitutes 14 out of the 18 bacterial isolates. From the data presented in Tables 4 and 5, the sensitivity and specificity of phenotypic screening compared to the genotypic screening were determined using the standard formula for specificity and sensitivity. Based on the mathematical computations, the sensitivity of the phenotypic screening in detecting the true ESBLs producing bacteria is at around 57%, which is relatively low. This means that using the usual phenotypic screening, which is commonly used in clinical laboratories, will miss out potentially harmful resistant strain of gram-negative bacteria, which may affect the treatment and management of the disease, which eventually may cost the life of the patient. However, its specificity is at 100%, which means that the phenotypic screening in this particular study was able to pinpoint all the true negative. Among the 18 gram-negative clinical isolates from the different hospitals, 44% were phenotypically identified to be extended spectrum beta-lactamase producers, while in genotypic screening using polymerase chain reaction, around 77% were detected. A total of 6 from the 18 isolates screened were failed to be detected using phenotypic screening. Hence, the sensitivity of phenotypic screening is relatively low at around 57%, which may have an impact in the treatment and management of the disease, while its specificity is at its best at 100%. In our study, 6 isolates were found to be positive in the confirmatory test but negative in the phenotypic test. Such discrepancy between screening and confirmation test has also been observed in other studies. This discrepancy in test results, aside from the previously mentioned genes, could also be attributed to some other additional resistance mechanisms. Based on the conclusions that were drawn, we can offer the following recommendations. First, inappropriate use of antibiotics must be curtailed. Thus, prudent prescription of antibiotics must be done. Second, clinical laboratories must consider their prime responsibility to detect and report accurately ESBL's producers for both screening and confirmatory tests. Third, education of medical and nursing staffs, patients, and other stakeholders through symposium, seminar, workshops, and other fora is strongly recommended. Since bacterial pathogens are constantly evolving, training must be an ongoing process. Lastly, standard operating procedure on infection control must be strictly implemented among hospitals. Development and implementation of hospital antibiotic prescribing guide should also be done. This ends my presentation. Thank you for listening, and may you all have a good day.
Thank you, Ms. Wolga, for that presentation. And now let's move on to the question and answer portion. Judges, please.
April, let me ask the first question.
Okay, go ahead, Sir D.
Okay. Good noon, Ms. Presenter. In your result on genotypic characterization (PCR), you mentioned that you were able to isolate 4 Escherichia coli in stool specimen. Am I right? So it's 4 out of 9.
Yes.
Do you think this is a significant finding given that E. coli is a normal flora of the intestine, and detection of E. coli in stool does not bear any pathological significance?
Okay, sir. Thank you for that question. So, sir, we also take into consideration about the source of specimen, where in this case is the stool, since according to nga po, E. coli can be normally found in the intestine. So, pwede po talaga na mag-positive ang stool. That's why, but in this case po, we just consider lang po the E. coli present in the stool as part of the result na lang din.
So you did not anymore determine what was the
exactly
the diagnosis of the patient in your data collection.
Hindi na po
Anyway, because, yeah. Another is given these results of your study, what do you think are the limitations of your research?
Okay, sir. The limitations, since there are still some instances wherein the result is negative, is that because of other, for example, the presence of the additional resistance mechanism. That's why yung mga nagna-negative po, hindi talaga exactly sure na negative.
Very good.
So,
okay.
Okay. Thank you.
May I ask?
Thank you.
Kasi you need to educate me because I don't know, no? But what's the gold standard for determining the presence of ESBL?
In this case po, the gold standard is molecular determination or the polymerase chain reaction po.
Kasi I'm questioning your statistics because you're computing for sensitivity and specificity. And you can only do that if you're comparing one test with a gold standard. And well, because I was curious, I looked it up, and according to what I read, the confirmation of the presence of ESBL should be done using an e-test. I don't know what that is, no? But they tell the paper that I'm reading tells the manufacturer. And this is what they consider the gold standard. So anyway, my point is, if neither phenotypic screening nor genotypic screening is the gold standard, I don't think you should compute for sensitivity and specificity. What you should compute for is agreement beyond chance. And that is the kappa statistic. Because if it's not the gold standard, for example, you said sa E. coli 390, phenotypic screening is negative, genotypic screening is negative. So there's agreement. But if the gold standard is positive, although there is agreement between these two tests, they're not accurate in detecting compared to the gold standard. So I think you just need to verify that, because personally, I don't know. But I just feel that if that neither of this is the gold standard, the better statistic to use will be the kappa statistic, or agreement beyond chance. Okay, so that ends my question. So baka Dr. Huban has a question.
Thank you, sir.
Ayan, wait. Yeah. Okay. Yung ano lang, ano yung conclusions mo kanina? What's the first conclusion dun sa may slide mo?
Yung pinaka.
Yeah, sorry ha. Parang yung
Okay.
about.
So the first conclusion was that among the 18 bacterial isolates from the different hospitals, 44% were phenotypically identified to be ESBL producers.
Ay, ano yung recommendation number 1?
Recommendation is bacterial strains will the inappropriate use of drugs.
Oo nga, kaya lang nagtatanong lang ako bakit paano mo na-relate yung dalawa, ang recommendation mo at sa conclusion mo, unless you mentioned, I know there is inappropriate use of antibiotics, but it wasn't
part of the objectives of your study.
Part of the objective, but napunta doon? Well, you probably have mentioned it in terms of of your introduction, and not mainly on the recommendation. The recommendation probably should focus on the results of your study, and at the end, and just related with regards.
Kasi there was also mention about hospital infection control, something like that. Other departments, which should not be part of the conclusion and recommendation.
Okay. Say by the mass. Say by the bell.
Wala na tayo.
Okay.
Okay.
Thank you po.
Na lang naman.
Thank you so much, sir and doctors.
Okay. Thank you.
All right. Thank you, Ms. Fulga and the rest of the judges. Oh, by the way, it's now 22 minutes past the hour of 12. Maybe we can go and have a quick 15-minute break. You can grab something to eat because I know it's already lunch break. So we're just gonna give you 15 minutes to grab something to eat. Okay, and we'll be back after 15.
Ano yun?
That's good.
Nagpa-grab ba kayo sa amin na judges? May sabihin mo? Okay, kayo
Hopefully next time po. I hope we have that option po.
Yeah.
Okay,
Sabi
so
niya,
again,
grab something to eat. Hindi niya sinabing nagpa-grab siya ng something to eat.
Na ako dun sa labas ng bahay ko pa naman.
Okay po, so again, see you later at 12:40.
Okay.
Exactly 12:40. Thank you.
EVHRDC, Eastern Visayas Health Research and Development Consortium. The Eastern Visayas Health Research and Development Consortium is a structure created by the Philippine Council for Health Research and Development of the Department of Science and Technology, which acts as the regional health research system for Eastern Visayas, guided by the mandate of developing and encouraging research activities in the region. The consortium links together researchers and institutions to facilitate health research activities attuned to the regional priority health needs and to the National Unified Health Research Agenda. The EVHRDC operates within an organizational framework through its commitment to attain the mission of providing an enabling environment for health research and development among institutions within the region. At the center of the framework is the research process, from generation of research ideas to protocol development, research implementation, and finally, research utilization. Based on this framework, the EVHRDC shall be the source of the research enabling environment, and the general public represents the consortium's ultimate consumer of all its policies, products, and technologies that could be the results of research activities. In keeping with its vision of being a transformative health research consortium in Eastern Visayas, EVHRDC aims to lead in the generation and utilization of knowledge, innovation technology, products, and services in promoting the health and improving the quality of life of the people in Eastern Visayas. The consortium is guided by the following core values in the realization of its vision and mission. In all interactions, we shall uphold technical excellence by encouraging each other on the importance of the scientific method of inquiry. Ethical fortitude, where respect for intellectual property rights shall be observed at all times, with regard to publication, patenting, and for non-academic media exposure. Resource sharing by employing utmost efforts in sharing of time, expertise, funds, information, or skills to fellow member institutions. And mutual respect among members, where interactions demonstrate utmost honesty, courtesy, and integrity. The EVHRDC holds its office at the Department of Science and Technology Regional Office Number 8, its designated technical secretariat. The consortium is composed of 32 member institutions, with 16 from state universities and colleges, 10 from national government agencies, and 6 from the private sector and hospital. The EVHRDC is composed of the Executive Committee, the 5 component committees, and the Secretariat, which serves as the coordinating body of the consortium. The Executive Committee is the overall governing body of the consortium and is charged with overseeing all administrative and operational concerns of the consortium. The members of the Executive Committee are the following: Dr. Minerva P. Milan, Committee Chair and the Regional Director of the Department of Health Eastern Visayas Center for Health Development. Its co-chair is Engineer Ernesto M. Granada, Regional Director of the Department of Science and Technology, Region 8. Dr. George M. Colorado, Regional Director of Commission on Higher Education, Region 8. Dr. Fulidito D. Tandinco, Dean of the University of the Philippines, Manila, School of Health Sciences. Dr. Edgardo M. Tulin, University President of Visayas State University. Ms. Maylin C. Rosales, OIC Regional Director of the National Economic and Development Authority. Sister Rosario R. Abinana, President of St. Scholastica's College of Tacloban. The Research Management Committee is charged with various affairs concerning the management of planned, ongoing, and concluding research projects. The members of the Research Management Committee are the following: Mr. Leonido P. Olavia, RMC Chair from the Department of Health Eastern Visayas Center for Health Development. Sister John Mary Fernelius of Mother of Mercy Hospital. Dr. Rolando O. Berinaga of the University of the Philippines Manila School of Health Sciences. Dr. Antonio E. Lim Jr. of St. Scholastica's College of Tacloban, Dr. Catalino P. Dottori Jr. of National Nutrition Council, Ms. Catherine O. Iglesias of Commission on Higher Education, Region 8, and Dr. Bayani L. Plus of Remedios Trinidad Romualdez Medical Foundation. The Capacity Building Committee is in charge of building and strengthening the capacity of member institutions in research activities and informing institutional partnerships. The members of the Capacity Building Committee are the following: Dr. Virgildo E. Sabalo, CBC Chair from the University of the Philippines, Visayas, Tacloban College, Dr. Reynaldo B. Garnase of Leyte Normal University, Ms. Elnora O. Arcada of Philippine Nurses Association, Dr. Lore Reretas of Philippine Academy of Family Physicians, Dr. Maria Cristina Caintek of Eastern Visayas State University, Ms. Pilar Eliza T. Maraya of Palumpon Institute of Technology, and Mr. Mark Anthony Malinaw of St. Peter's College of Vermont. The Research Utilization Committee is in charge of securing and managing information necessary for the operations of the consortium and its activities. The members of the Research Utilization Committee are the following: Dr. Sherry Ann C. Labit, RUC Chair from Samar State University, Dr. Francis Ann C. of Southern Leyte State University, Ms. Maria Victoria C. Quaizon of National Economic and Development Authority, Ms. Maria Elsa Hirano of the Department of Education, Ms. Gemma Tabao of Philippine Information Agency, Ms. Pia Monina Lovete of the Department of the Interior and Local Government, Dr. Esther Banyar of Eastern Samar State University, and Dr. Joey Diaz-Saniel of Biliran Province State University. The Structure, Organization, Monitoring, and Evaluation Committee is in charge of concerns regarding membership of institutions, hiring of secretariat staff, and selection of committee chairs and members. The members of the Structure, Organization, Monitoring, and Evaluation Committee are the following: Ms. Josephine L. Hipes, SOMIC Chair from the Philippine Institute of Traditional and Alternative Healthcare, Dr. Othelio B. Capuno of Visayas State University, Dr. Agripino B. Limpiado Jr. of Philippine Association of Medical Technologists, Dr. Leo M. Lacaba of Northwest Samar State University, Dr. Maria Victoria D. Naboya of Leyte Normal University, and Dr. Ruel I. Saba of Palumpon Institute of Technology. The Ethics Review Committee is the authority on research ethics within the consortium. The ERC is responsible for acting in the full interest of potential research participants and affected communities, taking into account the interests, needs of the researchers, and having due regard for the requirements of relevant regulatory agencies and applicable laws based on the World Health Organization operational guidelines. The members of the Ethics Review Committee are the following: Dr. Jane Burinaga, ERC Chair from Eastern Visayas Regional Medical Center, Engineer Florentino Quinones from the Department of Science and Technology Region 8, Dr. Jose Carlo Del Pilar of Eastern Visayas Regional Medical Center, Attorney Alma Sonia Danday of Leyte Normal University, Dr. Sara Delarino of University of Eastern Philippines, Ms. Noreen S. Buhat of St. Joseph College, Sister Maria Victoria Padiranga of Mother of Mercy Hospital, Father Patricio de los Reyes of Divine Word Hospital, Ms. Erlita Priniero of Commission on Higher Education Region 8, and Mr. Ricky T. Serrano.
Our mission is to make lives better for the Filipino. In more than 3 decades, the Philippine Council for Health Research and Development has invested in research and innovation, in people, in infrastructure, and in support systems to create an enabling environment for health research in the country, to generate innovations and solutions to our pressing health problems.
Created in 1982 as a sectoral council of the Department of Science and Technology, the PCHRD is mandated to coordinate all health research in the country. In 2013, the passage of Republic Act 10532, or the PNHRS law, further strengthened the PCHRD's leadership role in the Philippine National Health Research System as the national coordinating body for health research. The PCHRD has grown and expanded its services in the areas of agenda setting, research management, capacity building, research dissemination, translation and utilization, resource mobilization, and national and international collaborations. The Council, together with the Department of Health, the Commission on Higher Education, and the National Institutes of Health of UP Manila, sets the national agenda for health research. It does this by formulating the 6th-year National Unified Health Research Agenda, or NURA, which guides researchers who are seeking research funding. This national agenda-setting exercise was cited by the Council for Health Research and Development in Geneva as a model for low to middle-income countries in 2006. Within the NURA and the Harmonized National R&D Agenda, the Council supports collaborative research on drug discovery and development, omic technologies for health, functional foods, nutrition and food safety, dengue and other arboviruses, diagnostics, mental health, biomedical engineering and health technologies, information and communication technology for health, and disaster risk reduction and climate change adaptation for health. In other areas of the research agenda, the PCHRD teams up with the Department of Health in managing its health systems and policy research, and with the Philippine Health Insurance Corporation on health.
All right, welcome back, everyone. I hope you enjoyed your quick lunch break. Okay, so let's continue with the presentations for the student category. Our third entry is again from the University of the Philippines, Manila School of Health Sciences, who will be presenting the study entitled Mental Health Status and Resilience Among Students in Two Universities in Leyte. Please welcome Miss Arlene Joy Gonzaga.
Good afternoon, everyone. I am Meryl EVHRDC, and I am the presenter of Group B for a research entitled Mental Health Status and Resilience Among Students in Two Universities in Leyte. So let's start. Abstract. Mental health status and resilience status of college students can be highly variable. Mental health problems are common to college students, which made the students struggle due to academic and relationship factors at home and in school. This study primarily focused on assessing the mental health status and resilience of students in two universities in Leyte. It also sought to examine the relationship between mental health and age, sex, civil status, year level, course, and economic status, as well as the correlation between resilience and each of the said socio-demographic variables. The study utilized a descriptive correlational design where 409 students answered a survey of three parts. Part 1 is demographic profile, and Part 2 is the mental health status survey using the Key 10 or Kistler Psychological Distress Scale, and Part 3 is about resilience scale or the BRS. Findings show that the most of the respondents ranged from mild psychological distress to being mentally well, but 53 or 13% had severe psychological distress. In terms of resilience, most of the respondents ranged from normal to high resilience, but 115 or 28% of them had low resilience. Demographic correlates of psychological distress include all the demographic variables except family income, where the most vulnerable were those aged 18 to 24, female, single, first year level in college, and those taking midwifery course. For resilience, only age and course correlate with resilience, where those aged 18 to 24 and those taking medicine degree has low resilience group. The study pointed to the need for psychosocial care to minority but significantly important vulnerable groups. Statement of the problem focused on assessing the mental health status and resilience of students in two universities in Leyte. Specifically, this study was able to describe the demographic profile of the respondents in terms of age, sex, civil status, year level, course, annual family income, and also determine the mental health status of the respondents and determine the resilience status of the respondents. Correlate mental health status to age, sex, civil status, year level, course, annual family income, and correlate resilience status to age, sex, civil status, year level, course, annual family income. The research design, we used the descriptive correlational method. It described the different variables in the study and identified if there is a correlation between each of the demographic profile to mental health status and also demographic profile to resilience status. The research locale, this study was conducted in the two universities in Leyte, the University of the Philippines Manila School of Health Sciences, Palo Leyte, and Visayas State University Alang-Alang Campus. The research respondents, we targeted 438 students via random sampling and respondent and actively participated students are only 409 students. We randomly selected 306 students from VSU and actively participated 286 students, and the lacking students are 20 respondents. We also randomly selected 132 students from UPM SHS, but those who actively participated are only 123 students. We lack about 9 students. The reason is because of the sudden COVID-19 lockdown on March 2020. The sampling procedure, sample random sampling was used to select the respondents from the two universities. Data instrument and collection. The data was collected using a questionnaire. The first part of the questionnaire was the demographic profile, which the researcher was made. The second part of the questionnaire was the mental health assessment, and the third part of the questionnaire is the resilience assessment. So the second and the third part, we used the standardized assessment tool that is available on the internet. For the mental health assessment, we used the Kessler 10 or K10 or the Kessler Psychological Distress Scale 10, and the resilience assessment, we use the Brief Resilience Scale. For the data collection process, we determine the total number of students of UPM SHS and VSU Alang-Alang campus. Research questionnaires and informed consents were made. We visited the two universities personally with a communication letter addressed to the heads of the two institutions to seek permission. And the permission was granted, respondents were informed, and an informed consent was sought. Respondents were instructed to answer the questionnaires, and questionnaires was collected and checked for consistency and completeness. The data analysis. The data was summarized in tables. The data analysis consists of descriptive, correlational, and statistics with the aid of statistical package for the social sciences or SPSS version 2.0 statistical software. Statistical treatment of data. The data was subjected to different statistical tools in order to answer the research problems. We use the person-product moment of correlation for the mental status to age, mental status to annual family income, resilience to age, resilience to annual family income. And we also use point by serial correlations coefficient to mental health status to sex and resilience to sex. We use eta correlation, mental status to civil status, mental status to year level, and mental status to course, resilience to civil status, resilience to year level, and resilience to course. The research findings. The study found that majority of the students in VSU and UPMCHS were young adults, which ages from 18 to 24 years old, with a frequency of 293 or 71.6% of the respondents. Most of them were females with a frequency of 312 or 76.3% and were single with a frequency of 286 or 94% in terms of civil status. Moreover, majority of the students were enrolled in BS education with a frequency of 161 or 39.4%. In addition, majority of the students were freshmen or first-year college students with a frequency of 151 or 36.9%. Lastly, majority of the students belonged to below poverty line in terms of their annual family income with a frequency of 289 or 70.7%. The mental health status of the respondents. In terms of determining the mental health status of the respondents, the study found that majority of the respondents were identified as having mild psychological distress with 29.8% or 122 respondents, followed by moderate psychological distress with 29.3% or 120 of the respondents. Third, highest frequency was mentally well with 27.9% or 114 of the respondents. And lastly, severe psychological distress with a frequency of 53 or 13%. And this data implies that most of the students in VSU and UPMCHS were experiencing mild to moderate psychological distress, with some who were even experiencing severe psychological distress, which is also a serious matter that must be given immediate attention and intervention. Correlation coefficient between mental health status and their demographic profile variables. The study found that the annual family income variable was found no statistically significant correlation with mental health status variable with R value of equal to 0.031 and P value of greater than 0.05. Among the statistically significant demographic variables, the variable age shielded to have a negative correlation with mental health status variable with R value of R is equals to 0.226 and P value of less than 0.05, which indicate an inverse relationship between variables. The rest of the variables were directly related to mental health status variable with positive R values. This means that age, sex, civil status, year level, and course play an important role on how a student can be mentally well in college life, while it has been revealed that annual family income doesn't have a direct effect to the mental health status of the respondents. It is shown that in terms of the resilience of the students, most of the students rated themselves as having normal resilience with a frequency of 290 or 70.9%, followed by low resilience with a frequency of 115 or 28.1%, and lastly, high resilience with a frequency of 4 or 1%. The data implies that majority of the students in VSU and UPMSHS were found as having normal resilience. This indicates that the students were resilient, in which they could bounce back or adapt positively to life's adversity, and furthermore, being resilient would give them determination and perseverance to tackle problems and cope with emotional challenges in school, which is good for their mental health. However, the data have also identified 115 students or 28.1% having low resilience. On the other hand, students with low resilience could easily develop mental health problems like depression and anxiety, making them vulnerable to engaging in dangerous behaviors and giving up in life. Promotion of resilience in university is a must as resilience is important in helping students improve academically and protect the students from developing mental health difficulties and issues. Correlation coefficient between resilience status and their demographic profile variables. The variable age that is statistically significant yielded to have a negative correlation with resilience, which has an R value equal to 0.102 and P value of less than 0.05, which indicates an inverse relationship between variables. The variable sex has a negative correlation of R value equal to 0.089 and p-value greater than 0.05 and shows no significance to resilience. The remaining demographic variables yielded positive correlation with resilience and showed statistically not significant except the course, which is statistically significant. This means that age and course plays an important part on how a student can be resilient in college life. Conclusion: in the study, the student in UPM, ECHS, and VSU Alang-Alang have mild psychological distress, which means that they have good mental health status. The researchers concluded that the younger the students, the more vulnerable they are to academic stressors. Females are more vulnerable to psychological distress than males, and those non-married students experience more psychological distress than those who were married. Students in first and second year level experienced more psychological distress compared to third year and fourth year level, and students in BS education has the highest number of students experiencing mild, moderate, and severe psychological distress, followed by Bachelor of Science in Agriculture, Midwifery, and Bachelor of Science in Environmental Science, which means they have poor coping skills. There is a greater percentage of students that are mentally well who belongs to below poverty line than above poverty line, and students who experience psychological distress is also greater to those who belong to below poverty line. On resilience status, they have normal resilience, which means that students from the universities copes well and could adapt positively to life's adversity, but there is certain percentage that will need special attention. It can be concluded that younger students exhibit higher level of resilience compared to the matured ones. Majority of the students who are single have lower resilience than the married students. Thus, it can be concluded that having a partner in life can contribute to higher resilience. In year level, as the student progresses to higher year level, their coping skills improve. In course taken, MD has the lowest resilience among the 6 other courses taken by the students, and students from below and above poverty line have normal resilience. Based on the conclusions of this study, the researchers wish to recommend the following: conduct a mental health and resilience assessment to all the students enrolled in each institution for early detection of possible mental health problems and referral of screened mental unstable students. To conduct a regular mental health awareness session to the students, faculty, and staff. To incorporate resilience skill building into the subjects and teaching strategies for personal and academic development of the students. And we also recommend future researchers to conduct a follow-up study with a bigger sample size in order to validate this study and for the following specific purposes or topics. To extend research and further explore resilience of young adults and determine the factors that enhances or hinders their level of resilience. To have further research on factors that increases or decreases the level of mental health of students, and to have further research on academic resiliency of the students. And that would be all. Thank you.
All right, thank you for that presentation. And now we have Miss Arlene Joy Gonzaga to accommodate the questions coming from our Board of Judges.
Okay. Can I start, April?
Sure, Dr. Huben.
I would like to ask, how did you get the consent of all your participants, and what was incorporated in the consent? I'm worried on. I would like also to ask, how did you feedback the results of your survey to each of the individual, and what was done for those respondents who had the condition as mild, Ano ngayon?
Severe.
Mild.
Severe. Psychological
Mild
distress.
psychological.
Severe.
Yeah.
Severe psychological distress.
Those conditions.
Okay. Okay, sir. So primarily, we have submitted first this proposal to the ERC for ethics review, and then in the school, we were able to get the consent. Most of the students of the respondents, all of them are 18 years old and above already. But then we have also prepared consents in case there are students that are 18 years old and below, since this topic is quite sensitive. So what happened is that during our during our data collection, we have attached an informed consent already to the questionnaire attached to it. Before they answer the questionnaire, we see to it that they were able to understand well the informed consent and with regards to the purpose of this research. And then we made it clear to the respondents that this research, they will not be able to have direct effect of this research, but their answers will have a great help to the society and to the other universities as well. Yes.
Gusto mo follow up?
Again, no,
Okay.
yung advocacy ko is ethics, no, and I know in your manuscript you did mention that this underwent ethics. Please
Yes,
be
sir.
advised that you should name the ethics committee that approved your study. That's one. But more importantly, kasi your students, may I ask, you're a medical student ka ba?
I am a nursing student, sir. Licensed midwife and a nursing student in our school.
Okay. Pero are you trained in crisis intervention?
Yeah.
No.
I'm not sure prevention. Have undergone some seminars, but this research particularly, we don't do intervention. We just did
Yeah, I know,
assessment to be able to
but
get a baseline data.
so what happens if upon because of your survey somebody breaks down, somebody gets
Okay.
severe depression, becomes suicidal? So how will you handle such a respondent? That's my point, no.
Okay, sir.
Medyo high risk itong study na to. We usually don't
Yes, sir.
allow undergraduate students to undergo studies like this unless there is very active participation of your research advisor, and your research advisor is willing to take the responsibility of addressing any mental health problem that may arise as a result of your study. But that's on the side, and medyo I don't think you need to to answer that, because that's really not your call. Personally, your ethics committee should not really have allowed approval. My bigger question really is your sample size. In your sample size calculation, you just put 95% confidence intervals and a an alpha of 0.05. But isn't that a sample size calculation for prevalence?
Yes, sir.
Yeah, but your objective is not really to look for prevalence. Nagko-correlate ka ng several factors. So the sample size calculation is different. And I'm wondering whether you did not see any resilience pattern, not because there wasn't really any difference in resilience, but because your sample size was not powered for the resilience outcome. That's just my comment.
Noted, sir.
Okay.
Okay, do I still have the time? I was just okay. I was just wondering how you validated your data collection instruments, the Kessler-10 and basic resilience scale. How did you validate these instruments?
Yeah, I have the same
to
question.
the Philippine setting.
Local validation.
Sir, I'm sorry. Can you repeat, sir? I naglag, sir. Internet.
Yeah, my question was how did you validate the data collection instruments that you used in the study? The Kessler 10 and the basic resilience scale. How did you
Yes,
validate
sir.
them that before you started using it?
Oh, well, sir, we discussed it as well with our research advisor prior to the conduct of this study. In case there are things that is not applicable to the research setting, we can do revisions. But then, sir, since almost all of the entries in that public domain, which is available in the internet, is applicable, so we just use that one to the conduct of this study. We reviewed it first before conducting the actual survey together with
All
our
of them.
research advisor.
Okay.
Yes, sir.
Okay, sige. Okay,
All right.
thank you anyway.
Thank you, sir.
Okay. All right. So your time is up. And thank you, Miss Gonzaga and our board of judges. Okay. So
Thank
up
you.
next, you're welcome. Okay. Up next is the presentation of the study entitled Symptomatology of Depression and Suicidal Ideation Among First Year Students of Samar State University by Mark Kiamki Norumbaba of Samar State University.
A pleasant day to each and everyone, especially those who will be reviewing my presentation. So I am Markem Kinarumbaba, BE Psychology from Samar State University. I am the proponent of this study, Symptomatology of Depression and Suicidal Ideation among first-year students of Samar State University. For many students, the transition from high school to college life is filled with anticipation, excitement, and enthusiasm, along with the positive feelings often associated with university life. The new college students has many challenges to overcome. Researchers says, like Abdullah, Brian, Enox, and Wentre, prove that problems of adjustment initiate common most during first academic year of students. So this adjustment is difficult and multidimensional process, which requires many competencies to properly integrate with the environment, accommodation of new teachers and classmates, which may cause psychological, social, and academic difficulties and problems. The pressures of higher education elicit high anxiety rates, feelings of failure, stress, suicidal ideation, and depression among college students. So because of this, experiencing the symptomatology of depression and suicidal ideation during the adjustment period as a university student may bring difficulties to the student part in performing, participating, and fulfilling the goal expected from them. Thus, we as researchers conducted this study to see the relationship of depression and suicidal ideation among college students who are experiencing a big gap of adjustment from high school life to college life and explain the causes that contribute students' symptomatology of depression and suicidal ideation. This study aims to determine the adjustment difficulties of first-year students specifically. So here is the first objective of this study: if there is a relationship between students' demographic profile and depression, or students' demographic profile and suicidal ideation. And the second objective is, what are the adjustment difficulties of first-year students who are experiencing symptomatology of depression and suicidal ideation? To uncover and understand the adjustment difficulties of first-year students, especially those who experience symptomatology of depression and suicidal ideation, the researcher employed in this study the mixed method sequential explanatory design involving both quantitative and qualitative study to measure and to explore symptomatology of depression and suicidal students among college students of Samar State University. College Adjustment Scale was used to measure the student's level of adjustment, specifically the scale of depression and suicidal ideation for the first phase of this study, which is the quantitative phase. And those students who rated high on the scale of depression and suicidal ideation were interviewed one-on-one for the second phase, which is the qualitative phase of this study, to grasp the students' experiences on why they experience such symptomatology of depression and suicidal ideation. For quantitative phase, data were analyzed through SPSS, and thematic analysis were utilized in qualitative phase. So here is the result of our study. Out of 1,825 enrolled freshman students at Summer State University main campus, using the Slovene formula, there are 328 randomly students were chosen as a respondent for the quantitative phase. And those who rated high in the scale of both scale of depression and suicidal ideation were interviewed for the qualitative phase, and there are 11 respondents who respond our second study. In terms of sex, majority of the respondents in this study were female with 58.5% and male comprising 41.5%. In terms of age, majority of respondents is 19 years old with 39.94%, followed by 18 years old with 32.32%, 20 years old with 13.11%, and 21 years old with 5.79%, and the oldest respondent in this study is 25 years old with 22.44%. In terms of college program, the Summer State University comprised of 5 different colleges. The majority respondents comes from College of Education with 29.57%, followed by the College of Industrial Technology with 25%, College of Arts and Sciences with 22.56%, College of Nursing, Health and Sciences with 12.80%, and the College of Engineering with 10.06%. In the level of adjustment scale of depression, there are 25 students or 7.26% of the respondent is in the area of significant adjustment difficulties. In the level of adjustment in the scale of suicidal ideation, 47%, 47 students or 14.33% of the respondent is in the area of significant adjustment difficulty. It means that 7.26% and 14.33% of the respondents in this study experiencing symptomatology of depression and suicidal ideation. The relationship between students' demographic profile and depression, it was revealed that depression is not significantly correlated to students' demographic profile. In the relationship between student demographic profile and suicidal ideation, correlation is noted in terms of sex. 3 themes emerged in the analysis of data for the qualitative phase. The main themes, subthemes, and significant statement of the respondents were shown in the table 9. Major themes emerged in this study are new environment, family problem, and low self-esteem. The result of the test used in this study would not conclude that students who rated high in depression and suicidal ideation will be clinically diagnosed to have depression and suicidal ideation. But the result of the test might be useful as screening purposes to identify students who are experiencing symptomatology of depression and suicidal ideation and to address students' psychological concern. For quantitative phase surveyed result, the literature being supported is different from the result we come up from this study, but the literature mentioned above could be a result of students' cultural background, experiences, and socialization processes. Qualitative phase give an insightful view from the quantitative result of being high in the scale of depression and suicidal ideation. The emerging themes such as new environment, family problem, and low self-esteem can be a factor that will elicit the discomfort feelings of first-year college student. This emerging theme, a good supporting explanation why some students rated high on both scale of depression and suicidal ideation in the quantitative phase. These findings can help guide the development of campus-based program at a university towards addressing psychological disturbances of university students. So here is my recommendation based on the result regarding the relationship between demographic profile and depression, demographic profile and suicidal ideation. It was found out that there is no significant relationship, contradicting from the literature being supported. Hence, it is important to study further, especially in the local area, to see if the demographic profile of a student in terms of age, sex, college program, are related to their experiences of depression and suicidal ideation. More research is needed towards building additional local knowledge on this topic. Thank you so much for listening.
All right, thank you for that presentation, Mr. Narumbaba. Now let's move on to the question and answer portion. Mr. Narumbaba, please turn on your video.
So can I start?
Yes.
Yes,
Yeah.
sure.
Yes, sir.
Good afternoon, everyone. Again, no, I, uh, I would like to reiterate. This is more of a comment than a question. The importance of yung ethical considerations dito sa study. I know that this underwent ethics review, pero your responsibility as a researcher doesn't end with just doing this survey.
Yes.
Naghang si Jojo.
That is the bird or you just keep the secret? Ayun, nag-freeze yun.
Yes, Mr. Doc Jaja, it seems like he got disconnected earlier. I mean, will you please repeat your recommendation?
Did you get my question?
Unfortunately, we were not able to.
Sir.
No, so my question is again, no, reiterating that your responsibility does not end with just getting ethical clearance. How did you handle or what did you do to those respondents who you found to have suicidal ideation?
We are going to during the interview, sir, when we found out that some of our respondents have a suicidal thoughts, we are refer them to our guidance, to our registered guidance counselor in our school to alleviate their emotions. Sir. So refer them to our registered guidance counselor in our school.
Yeah, I was saying that maybe you should write that in your write-up so that those who read your paper will be at peace with knowing that your respondents were taken care of. May I ask another question? I'm not too clear on the assumptions that you used for your sample size calculation. It just says you used Slovin's formula. Slovin's formula for what?
Slovene
Marami
formulas are to determine the sample size of our study.
yeah,
Since not all the
sample size for a single proportion. Kasi it looks like it's just a sample size for a proportion which will only address your objective of the prevalence. But when you're going to do
Associations.
analysis or multivariate analysis, iba na yung sample size. And I have a feeling it's possible that the reason why you didn't see anything was because, again, your sample size may not have been powered. So that just consider that.
sir.
Okay ka na, Jo?
No further question.
Okay. I can just one question, Mark. I was just
Yes, sir.
uh, I was just wondering why there are three papers on the student category all about mental health and depression. Is that something that is a problem right now among studentry or among the youth? That's why it comes to one of it's the most common topic right now. It's 3 out of 5 actually.
Sir,
You have any
hindi ko po
idea,
marinig, sir.
Mark? Mark, do you have any idea why the topic of depression, suicide, resilience is chosen by the student researcher right now?
Because sir, I believe that this topic is very relevant nowadays, especially in this our the, especially the situation we are facing right now. Most of our youth or students are experiencing depression, especially in schools. Yung mga estudyante natin ngayon ay nakakaranas ng depression dahil siguro because of our new normal situation. That's all, sir.
Okay, thank you. Jing.
Any more questions?
Yeah.
The judges?
Yeah, I will just also ask the same question again about the college adjustment scale that you mentioned as your data collection instrument. How did you
Yes, sir.
validate this instrument before you started using it? How did you validate the instrument college adjustment scale before you started your actual data collection?
Yes, sir. Since the college adjustment scale is used by our school, the guidance office, so we still validate it through the Chromebook through Chromebook to determine if the the tools or the test up is appropriate to use in our setting.
Did you do some pre-testing before you launch your data collection? Did you conduct pre-testing of the scale, Carlos adjustment scale?
All right, time is up. I think you were saved by the bell. If I were one of the judges, I agree with Dr. Huban. I would also ask if mental health is something of concern today. Yes, because majority of our entries from the student category are more on mental health. So again, congratulations, Dr. Narambaba and the rest of the judges. Okay, and our last but definitely not the least presenter is Mr. Renz Amador Bagas from Remedios Trinidad Romualdez Medical Foundation, Tacloban City. The title of the study is Synthesis of Plant-Mediated Silver Nanoparticles Using Carica papaya leaf extract and its antibacterial activity against Pseudomonas aeruginosa and Staphylococcus aureus.
To the distinguished Board of Evaluators, guests, and visitors, a pleasant day to each and everyone. My name is Renz Amador Bagas, and I will be presenting our study entitled Synthesis of Plant-Mediated Silver Nanoparticles Using Carica Papaya Leaf Extract Against Pseudomonas aeruginosa and Staphylococcus aureus. In this study, we conducted a biosynthesis of silver nanoparticles with the use of varying concentrations of Carica papaya leaf extract as a reducing agent. Antimicrobial application of the synthesized silver nanoparticles against Staphylococcus aureus for gram-positive and Pseudomonas aeruginosa for gram-negative representatives of common bacterial species to cause nosocomial infection in hospital settings. The study will help us understand the future role of biosynthesized metallic nanoparticles as a possible replacement for the antibiotic treatment of bacterial infections, especially those caused by multi-drug resistant bacterial pathogens. Bacterial infections have emerged as a leading cause of high death rates in hospitalized and immunosuppressed patients. Since the discovery of the first antibiotic by Alexander Fleming on the late 1920s, increasing trend in the development of resistance to almost all available antibiotics due to unauthorized dispense and improper use of these drugs has become a major global health problem. Increased proliferation of multi-drug resistant strains in hospital settings are mainly attributed to the frequent gene mutation and accessibility of genetic transfer to other bacteria. Problems in bacterial infection is further augmented by the development of biofilms in medical devices. These biofilms and its related infections evade the traditional actions of different antibiotics. Because of this, there is a revolution on the studies looking for alternative effective antimicrobial. Nanomaterials have been a top candidate for the development of these alternative antimicrobial agents. This is attributed to the selected physical and chemical characteristics of nanomaterials which enables them to easily interact with microbial membranes, making it an effective antimicrobial agent. Several metals, metal oxides, metal halides, and bimetals in nanoparticulate form have been documented for antibacterial activity, and bacteria are less likely to develop resistance from these nanoparticulate materials. Antibacterial actions of metallic nanoparticulate materials involves a wide array of mechanisms such as first, disorganization and alteration of bacterial membrane permeability due to the release of metal ions coupled with the actions of reactive oxygen species. Second, ribosomal destabilization. Third, DNA synthesis inhibition. And lastly, protein synthesis inhibitions. These mechanisms are comparable to the actions of common antimicrobial agents. Over the last decade, green nanotechnology has been a remarkable global focus for the synthesis of metallic nanoparticles, utilizing plant and prokaryotic materials as reducing agents. These biogenic synthesized metallic nanoparticles inhibit generation of toxic byproducts, making it potentially safe for human use. Tepayawat et al. In 2016 showed that the antibacterial activity of metallic nanoparticles are coupled with the activity of bioorganic compounds obtained from the biogenic reducing agent. This is supported by the studies conducted by Nayak et al. In 2016 that utilizes biologically synthesized silver nanoparticles from Ficus binhalis and Achilpa indica demonstrated antibacterial potential against selected gram-positive and gram-negative bacteria. Silver nanoparticles' bactericidal activity is attributed to the same mechanism of antibacterial activity with other metallic nanoparticles. However, the biosynthetic nanoparticles have not been found to surpass the non-biosynthetic metallic nanoparticles in its antibacterial effect. Objectives of this project. The primary aim of this study is to determine the antibacterial activity of synthesized silver nanoparticles using carica papaya leaf extract against selected gram-positive and gram-negative bacteria. Specifically, the study aims to, first, to determine the antibacterial activity of the synthesized silver nanoparticles using carica papaya leaf extract against Staphylococcus aureus and Pseudomonas aeruginosa with the following preparations: 1 ml, 2 ml, 3 ml, 4 ml, 5 ml of carica papaya leaf extract with 1 ml of silver nitrate. Second, to determine the significant difference in antibacterial activity of the synthesized silver nanoparticles using carica papaya leaf extract against the test bacteria. Third, to determine the significant difference in the antibacterial activity of synthesized silver nanoparticles using carica papaya leaf extract against the test bacteria compared to positive and negative control. Methodology. Experimental type of research design was utilized in the study. The antimicrobial property of synthesized silver nanoparticles using carica papaya leaf extract was determined by selected test bacteria. Distilled water and commercially available antimicrobial agent served as negative and positive control respectively. The statistical analysis used in the study are as follows. Analysis of variance was utilized in determining the significant differences in zone of inhibitions of various silver nanoparticle preparations. On the other hand, t-test for small samples was utilized to determine any significant difference in zone of inhibitions between the two organisms and in the comparison of zone of inhibitions of test organisms against the positive and negative control. Preparation of carica papaya leaf extract. Carica papaya leaf extract was prepared by collecting several papaya leaves, wash them with tap water to remove epiphytes and necrotic leaves, and then they are shade dried for about 10 to 15 days. After 10 to 15 days, they are powderized using mechanical blender. 10 grams of this powdered leaves was boiled with 100 ml distilled water by hot percolation method. The resulting preparation was filtered until no insoluble materials appeared in the broth. Varying amounts of carica papaya leaf extract, namely 1 ml, 2 ml, 3 ml, 4 ml, and 5 ml, was added to 1 ml of silver nitrate solution respectively, and then it was mixed for 3 minutes. It was then allowed to stand for 24 hours at room temperature away from light. After 24 hours, the reduction of silver ions was then measured by subjecting the solution to UV visible spectroscopy using Shimada Zoo 1800. Antimicrobial screening was performed via the process of modified Kirby-Bauer disk diffusion method. The clinical isolates Pseudomonas aeruginosa and Staphylococcus aureus were obtained from stock cultures of RTRMF Medical Technology Laboratory. The test organisms were subcultured into separate tryptych soy broth, standardized using McFarland standard after 24 hours. Modified Kirby-Bauer disk diffusion method was utilized for this study. The standardized test organisms were inoculated in Weller-Hinton agar, and then standardized sterile filter papers were impregnated with different silver nanoparticle preparations and were placed strategically in Wheeler-Hinton agar. Clindamycin and amikacin were used as positive controls for S. aureus and Pseudomonas aeruginosa respectively, while distilled water was used as negative control for both organisms. Zone of inhibitions were used as indicator of antimicrobial activity were measured after 24 hours of results and discussions. Figure 1 shows that the highest absorbance of all preparation has peaked at 4. This is near the infrared region of the spectrum. This indicated that the formed silver nanoparticles has agglomerated, and based on Beer-Lambert's law, the broad peak absorbance illustrated the high concentration of silver nanoparticles in the solution. Although researchers followed such certain measures, agglomeration was still produced. Nevertheless, this did not impede the formed silver nanoparticle substance to have an effect to the antibacterial application of different carica papaya leaf extract preparation. Table 1 presents the antimicrobial property of different preparations of silver nanoparticles against Staphylococcus aureus and Pseudomonas aeruginosa as indicated by the zone of inhibitions. Silver nanoparticle prepared from 1 ml of carica papaya leaf extract shows relatively higher zone of inhibitions, 13.3 and 13.7 millimeters respectively, against the two test bacteria. Table 2 is the summary of statistical analysis done using analysis of variance in determining any significant difference in the zone of inhibitions of different silver nanoparticle preparations against Staphylococcus aureus. Computed F value of 0.810 shows no significant differences in mean zone of inhibition were observed among different silver nanoparticle preparations. This means that the concentration of extract is not a factor in its reducing capacity. Based on the findings, 1 ml of silver nanoparticle preparation was chosen to be used in succeeding trials. Table 3 is the summary of statistical analysis done using analysis of variance in determining any significant difference in zone of inhibitions of different silver nanoparticle preparations against Pseudomonas aeruginosa. Computed F value of 0.66 shows no significant difference in zone of inhibition were also observed among the different silver nanoparticle preparations. Thus, 1 ml of silver nanoparticle preparation was chosen to be used in succeeding trials. The similarity pattern of the absorbance versus wavelength observed in visible spectroscopy result agrees with the obtained statistical analysis in which there were no significant differences in different silver nanoparticle preparations. Table 4 presents the antimicrobial activity of 1 ml silver nanoparticle preparation against Staphylococcus aureus and Pseudomonas aeruginosa. It also shows that the zone of inhibition of both positive and negative control. The antimicrobial activity of 1 ml silver nanoparticle preparation against both test organisms is relatively the same. Using t-test for small samples, Table 5 shows that the antimicrobial activity of 1 ml silver nanoparticle preparation against the test organisms was compared to that of positive and negative control respectively. Computed t-value of 11.43 and 10.82 shows significant difference between the test sample and negative control against Staphylococcus aureus and Pseudomonas aeruginosa respectively. This could be interpreted that silver nanoparticles has a potential antimicrobial property as indicated by its mean zone of inhibition compared to the negative control. However, the computed t-value of S. aureus, which is 20.61, and Pseudomonas aeruginosa, which is 20.67, shows a significant difference between the silver nanoparticle and the positive control. which means that the potential antimicrobial property of silver nanoparticle is not comparable to that of commercially available synthetic antibiotics. Conclusion. Based on the findings of the study, the following conclusions were drawn. First, the biosynthesized nanoparticles using carica papaya leaf extract has potential antimicrobial activity to Staphylococcus aureus and Pseudomonas aeruginosa. Second, there was no significant difference in antimicrobial property of silver nanoparticles against Staphylococcus aureus and Pseudomonas aeruginosa. This is conclusive with the researches performed by Hemeg in 2017 and Venkateswarlu et al. In 2015. Third, significant difference were observed between 1 ml of silver nanoparticle preparation on both positive and negative control, which means that the silver nanoparticle has antimicrobial property but not comparable to that of commercially available antibiotics. Recommendations. The researchers therefore recommends that similar studies should be conducted using other plant extract as a reductant with the emphasis on the effects of biosynthesized silver nanoparticles to human biological system must be considered as well in future studies. The researchers also recommends to perform additional particle classification and confirmation using other techniques such as Fourier transform, infrared spectroscopy, scanning electron microscopy, and transmission electron microscopy. That's all for our study. Thank you for listening.
Thank you, Mr. Bagas, for that presentation. And now I'm giving the floor to our Board of Judges for the question and answer portion.
April, let me have the first question.
Okay, go ahead, sir.
Okay, thank you, Mr. Presenter, for your laboratory-based study. I just have some clarification. In your introduction, you mentioned that there are already bacteria that are known to be susceptible to silver nanoparticles. Meaning to say, these bacteria have known antibactericidal activity. This to and you mentioned a lot of them, and you mentioned particularly Pseudomonas aeruginosa and Staphylococcus aureus, which is these were the bacteria that you use this study. So my question is, what do you think is the justification why you still have to determine the antibacterial activity of silver nanoparticles to these bacteria, given that you have already mentioned that they are already proven to have antibacterial activity? What is the justification of your study?
We still did use Staphylococcus aureus and Pseudomonas aeruginosa because as it has mentioned on our paper, these are significant clinical isolates that causes nosocomial infection. So we are trying to prove on this study that this can be used for isolates that are directly collected from hospitals that can possibly become a cause for nosocomial infections in the future.
Okay, another question. Your results showed that your preparation of 1 ml silver nanoparticles did not actually match the antimicrobial property of commercially available antibiotics. What do you think is the reason why you did not attain this goal? Why did not match with the Is it because of the inherent property of your preparation, or actually there was something wrong with the methods?
I think there was no. If we will confirm it, if we will look into the standard methods used for the synthesis of silver nanoparticles, we followed the standard methods that was used by our reviewed literatures. So it might be that there can be outside factors that has come in, and also with the reviewed literatures, they can't really say there is no significant results also when compared to the synthetic antibiotics. So this is just a preliminary evaluation. So this could further be remodeled, this could further be developed to enhance its antimicrobial property that could be utilized for future use.
Okay, one last question. If you're given another opportunity to conduct the same study with funding, what do you think are the areas of your research that you need to improve in order to at least come up with antibiotics that will match the commercially available antibiotics that you've been used? If you will be given another
Yes, sir.
A research fund to improve the methodology, what do you think will you do?
Yes, sir. If because this study was conducted when I was still in my undergrad year, so we lack fundings, we lack resources. So if we will be given a chance to modify this study with a better funding, first and foremost, we can directly attack the synthesis type using a higher grade type of synthesis using other advanced methods to check if these silver nanoparticles are present, such as the use of FTIR, scanning electron microscopy, which was not utilized in our study kasi nga we have no enough money to access those materials or those methods.
Okay, thank you. That's all.
You're welcome,
All
sir.
right, do you have other questions from the other judges? Dr. Montaring and Dr. Huban, do you have other questions?
Yeah, more of a comment ako. I think you should have justified why you chose papaya, because this study has been done using other, what do you call that? Using other extracts. In fact, I saw a study while researching on yours on the use of lantana, and it had very high silver nanoparticles, enough to have zones of inhibition, which is as big as the positive control. So my question is, why did you choose papaya? And maybe for improvement of your paper, that should be emphasized.
Yes, Doc. We use the papaya because this has what they call this, an existing paper supporting its antimicrobial activity. We just want to prove that if this paper could be, if this methods of this leaf extract would be utilized, if the papain which exists in the papaya would be inhibited by the silver nanoparticles. Plus, in the knowledge of natural product development, we should always consider the factor of geographical location where the materials were obtained as also a contributing factor for the development of this silver nanoparticle. So there is a varying, let's just say there is a hypothetically varying effects of these leaf extracts per geographical location. So in the Philippines, yes, there are already determined study on the different regions, but within the Eastern Visayas region, there is not yet approved what they call this, a study for silver nanoparticles using carica papaya leaf extract, and even maybe other types of leaf extract.
Okay. I suggest that you strengthen that in your write-up.
Thank you, Doc.
Yeah.
All right, so I think those are the questions coming from judges. How about Dr. Huban?
I have no more questions for you.
Okay, all right. So thank you, Mr. Bagas.
Thank you.
And thank you also, judges.
Thank you, Doc. Thank you, sir.
All right, there you have it. Our 10 contenders for this year's. Hold on, let me just turn on my video. Okay, so those are our 10 contenders for this year's oral research paper presentation. So congratulations everyone for a job well done. I'm sure you have given our board of judges really a hard time deciding who the winners would be. So to give our judges time to deliberate, just like what happened yesterday, we will be putting them in a breakout room for more or less 30 minutes. So to our board of judges, Raymond, one of our staff, is already working on the breakout rooms. So whenever it's ready, he will automatically put you in the breakout room. All right. I believe our board of judges are now being transferred to a separate room. Okay, so as mentioned earlier by Dr. Mantaring, 10% of actual presentation is scored based on the presentation's overall impact on the audience. That's understandability, concise reporting within the given time frame, which is the 5 minutes. And for us to score our presenters in this specific criterion, maybe we request all our participants to go to www.menti.com. Let me just share that. Just give me a second here. Please allow me to share my screen. Okay, are you able to see my screen now? Can you show me a thumbs up if you're seeing the screen now? Again, this is 10% of the total score. Okay, great. I think our participants are now seeing the screen. Okay, so all you have to do is go to www.menti.com and please put on the code put in the code 30311140. Again, the code is 30311140. So your vote will really matter. So please go to the website now and cast your vote. So the first question is, among the presentations for the professional category, which do you think has been clearly and concisely reported within given time frame? Again, this is only for the professional category. We're going to be having another set of poll for the student category. So again, among the presentations for the professional category, which do you think has been clearly and concisely reported within the given time frame? We have 6 participants. We're going to wait for more responses from we have a total of 83 participants, so I am expecting at least 80% or 90% of our participants to answer this poll. Again, please continue casting your votes. It is also another way for you to show your support to your institution's participants, or I mean the participants from your institutions. We have in the first place, we have the ingestion of microplastics by zooplankton in San Pedro Bay, Leyte. Only 12 participants have casted their votes. Please continue casting your votes now before we move on to the next poll, or to the next question for the student category. Okay, keep your votes coming. Okay, I'm going to give you 1 more minute to give your vote. By 1:55, we will be closing this first question, and we will move on to the student category. All right, out of 84 participants, 19 has already casted their votes, and it's already 1:55, so we now move on to the next question. All right, so our next question is, among the presentations under student category, which do you think has been clearly and concisely reported within the given time frame? All right, one has voted. How about the rest? Okay. We have 7 votes for a comparative study on the compliance in maternal and child health care services among 4Ps and non-4Ps mothers in Tanawan, Leyte. So far, no one has voted yet for mental health status and resilience among students in 2 universities in Leyte. We have 4 votes for synthesis of plant-mediated silver nanoparticles using carica papaya leaf extract and its antibacterial activity against Pseudomonas aeruginosa and Staphylococcus aureus. Okay, finally, one voted for mental health status and resilience among students in 2 universities in Leyte. And we will close this poll at exactly 2 p.m. So please keep your votes coming. Right now, we have 5 votes for symptomatology of depression and suicidal ideation among first-year students of Samar State University. Right, 2 more minutes. We have 28 respondents. Where are the other 70, more or less 70 participants? One more minute left. Okay. We have 33 respondents now, and it's already 2 p.m. So we're closing this poll now. All right. So thank you for voting, and we will be forwarding these results to our board of judges. So thank you for participating. Just give me. Okay, so while waiting for our judges to finalize their scores, we have some institutional videos for you to watch. Thank you.
Our mission is to make lives better for the Filipino. In more than 3 decades, the Philippine Council for Health Research and Development has invested in research and innovation, in people, in infrastructure, and in support systems to create an enabling environment, generate innovations and solutions to our pressing health problems.
Created in 1982 as a sectoral council of the Department of Science and Technology, the PCHRD is mandated to coordinate all health research in the country. In 2013, the passage of Republic Act 10532, or the PNHRS law, further strengthened the PCHRD's leadership role in the Philippine National Health Research System as the national coordinating body for health research. The PCHRD has grown and expanded its services in the areas of agenda setting, research management, capacity building, research dissemination, translation and utilization, resource mobilization, and national and international collaborations. The Council, together with the Department of Health, the Commission on Higher Education, and the National Institutes of Health of UP Manila, sets the national agenda for health research. It does this by formulating the 6th-year National Unified Health Research Agenda, or NURA, which guides researchers who are seeking research funding. This national agenda-setting exercise was cited by the Council for Health Research and Development in Geneva as a model for low to middle-income countries in 2006. Within the NURA and the Harmonized National R&D Agenda, the Council supports collaborative research on drug discovery and development, omic technologies for health, functional foods, nutrition and food safety, dengue and other arboviruses, diagnostics, mental health, biomedical engineering and health technologies, information and communication technology for health, and disaster risk reduction and climate change adaptation for health. In other areas of the research agenda, the PCHRD teams up with the Department of Health in managing its health systems and policy research, and with the Philippine Health Insurance Corporation on healthcare financing. These partnerships augur well for the implementation of the Universal Health Care Act. The PCHRD promotes health research ethics as the country's commitment to the protection of the rights, welfare, and well-being of human participants in research. Together with the Philippine Health Research Ethics Board, or PHREB, the highest policy-making body for ethical issues in human health research, the Council aims to strengthen institutional ethics review boards from registration to accreditation. Generated from the funded projects of the Council were important healthcare policies, products, and services. Even before the passage of the Technology Transfer Law of 2009, the Council already undertook technology commercialization, which seeded the growth of medicinal plant products in the country. Lagundi for cough and Sambonga's treatment for kidney stones are now household names. The Council's support for a dengue diagnostic kit led to the creation of the first startup company out of the UP system. Now the award-winning biotech M-Aqua kit is available in the market with sensitivity and specificity comparable to the standard test, but at a much lower cost. The Council's experience in technology transfer show the importance of the private sector as a partner. In 2012, the PCHRD was the first council that invested in a joint research with the industry through the Orthopedic International Incorporated. This joint research led to the Access Knee System for arthritis, which is now used by orthopedic surgeons for patients needing knee replacement in the country and soon in Asia. Built for Filipinos and other Asians, the Access Knee System cost 40 to 50% lower than what's currently in the market. With health innovations in the pipeline, the Council is, at the same time, building the capacity of research institutions and researchers to make sure that research projects are technology and industry ready. Research for evidence-informed policy making is an equally important path for our research outputs. Our supported researches contributed to the development of the expanded program on immunization, the Newborn Screening Act, the National Health Insurance Act, the Philippine National Health Research System Act, the National Integrated Cancer Control Act, and the Universal Health Care Act. The PCHRD established the country's first online databases and information services through its Health Research and Development Information Network platform of Unified Research Information Management Systems, or HRDIM+. It is the only national health research repository containing more than 60,000 records. This resource is linked with the Western Pacific Region Index Medicus and subsequently the Global Index Medicus. The expertise that the Council developed in online databases allowed it to come up with a clinical trials registry with the Food and Drug Administration and an online project management system. To ensure that the country has a cadre of researchers who will undertake needed researches, the PCHRD provides scholarships, research fellowships, and other assistance for capacity building. The PCHRD is also developing a new crop of clinical researchers through our MD-PhD program and Masters in Molecular Medicine. The pioneering MD-PhD program is the only degree program in the Philippines that combines the features of MD and PhD courses in one, offering a unique opportunity for some of the best and aspiring young Filipino scientists to train for careers dedicated to the advancement of health through biomedical research. The Council's research fellowship programs are opportunities for collaborative R&D and capacity building for Filipino researchers through partnerships with leading research institutions worldwide. There are also incentives for young researchers to go into research careers. Likewise, recognition is given to mentors who share their expertise with beginning researchers. Equity in development. This is what PCHRD had in mind from its inception. In 1984, the first regional research consortium was formed. To date, each of the 17 regions has a research consortium, including the Bangsamoro Autonomous Region in Muslim Mindanao Health Research and Development Consortium. The idea is to capacitate each region towards self-determination in health research, thus increasing the country's research pool and research productivity. One feature of the regional consortia is the Regional Research Fund. This is a strategy of the Council to encourage new researchers to be actively involved in health research activities without having to compete with more experienced researchers. RRF projects are intended to build the capabilities of researchers in designing, implementing, and managing health research projects.
This is very consistent with our goal or our program of expanding our R&D base, our R&D pool, particularly spreading it across the country so that these research institutions located in various parts of the country can take up the challenge of addressing the needs in the region and also taking advantage of the opportunities that are available in the region.
Technology transcends nation-state borders. The Council sees integration of economic blocks, such as our own ASEAN, as one economic community. Over the years, the Council has slowly built its partnerships with international organizations and programs. Among these are ASEAN Network for Drugs, Diagnostics, Vaccines, and Traditional Medicines Innovation, the Regional Platform for Collaborative R&D among the member states of ASEAN in collaboration with the World Health Organization TDR, the Special Program for Research and Training in Tropical Diseases, Newton Agham Program, E-Asia Joint Research Program, Southeast Asia-Europe Joint Funding Scheme for Research and Innovation, and ASEAN Science and Technology Innovation Fund. The Council also has partnerships with some of the world's leading research institutions, such as the United States National Institutes of Health, the London School of Hygiene and Tropical Medicine, Mayo Clinic, Harvard University, and Massachusetts General Hospital, among others. What sustains a health research system is communication. With this in mind, the Council maximizes the use of traditional and new media. Partnership is employed as a strategic approach. Partnership with media, partnership with the regional consortium's communication teams, and partnership with everyone who shares the Council's vision.
The DOS PCHRD is composed of professionals who are up to their game and know exactly what the country needs for the health sector.
Decades may have passed, but the PCHRD's mandate remains the same. PCHRD, making your life better.
All right, so I believe the scores are ready with one of our staff, and we're just finalizing everything before we proceed to the awarding of, before the announcement of the winners. So let's just give additional, probably 2 to 3 minutes for us to complete that, and once we have it, we'll proceed to the announcement of the winners. So how is everyone doing so far? Maybe we have
We are
some
fine,
feedback.
Miss April.
Wow, good job. Hi, Ma'am She. All right, so I hope everyone is still
Hi, Miss
enjoying the.
April.
Hello po.
Yes, we are.
No, this is our first time
We
doing
have
this.
very good papers this year.
I
Yeah.
agree with you. I agree with you, Dr. Labid. And this is our first time doing
And
this
we
in a
also
virtual
have
platform.
good judges evaluating.
Yes, I agree with you. Yep. So yes, we had a lot of technical issues earlier. Some of our presenters were not able to connect
Yeah.
right away.
I think it's because yeah. I think it's because there's typhoon. So that's why we have very low internet connectivity in the region.
Yeah, but we really hope that everyone is doing okay. We only pray for everyone's safety, and not just because of the typhoon, but also for with the ongoing COVID. I hope everyone's safe. All right, so I think the score is on already and has been finalized. Okay, so since that all of our judges are now back, and we know how really difficult it was for them to choose the winners, so I think it's just and right for us to give them the certificates of our appreciation. All right, so right now we have the one of the members of the EVHRDC Executive Committee from the University of the Philippines Manila School of Health Sciences to award the certificates of appreciation to our Board of Judges. Please welcome Dr. Filidito D. Tandinco.
Hi, good afternoon. I think I there. Sorry. On behalf of the EXECOM of the Eastern Visayas Health Research and Development Consortium, I would like to present this certificate of recognition to Mr. Leonido Piolobia for serving as one of the honor judges of the oral research presentation contest, professional and student categories during the 2020 Regional Health Research Symposium held on October 29 to 30, 2020 via Zoom.
Thank you very much, Dr. Joboy. May picture taking ba?
Wala na. Kasi tanggalin ko yung mask.
Siguro
Yes,
meron
there
na.
is. Yes, there is po. Let me just prepare it. Okay, so
Ngayon na.
in a count of three. Yes, Sir Ding, please remove your mask.
Sorry.
Okay, let me take the picture. 1, 2, 3. There you have it. Thank you.
Thank you, Sir Mr. Olovia. This certificate is, of course, signed by Dr. Minerva Pimolon, MD, MPH, FPPA, CESO 3, the Regional Director of EVHRO 8, and the Chair of the EVHRDC Executive Committee. A similar certificate is awarded to Dr. Noel R. Huban, also a member of our panel of judges this afternoon. Dr. Noel Huban.
Yeah. Yes. Bakit?
And shall I go to the next?
We're going to take the picture yet first, sir.
Okay.
Okay, let's take the photo. Okay, and count. I'll count 1, 2, 3. 1, 2, 3. Smile. All right. Thank you.
Thank you, Doc.
Thank you.
And, of course, last but not least, similar certificate of recognition is awarded to Dr. Hasim Prabhas B. Mantaling III, the chair of our panel of judges for the oral research presentation contest.
Thank you, Dean Cantingo.
Thank you, sir.
Okay, let's take your picture in 3, 2, 1. Thank you.
Salamat.
Joboy pala yun.
All right, thank you, Dr.
Partner nyo sa UP.
Oo nga, bossing.
Gagwapo ng bossing ko ah.
Bait pa.
Okay, this year's RHRS could not have been possible without our presenters. So let's give them a round of a virtual applause for all the presenters who have given their time, effort, dedication, and so much more to make this symposium a success. All right, so let's give them a virtual applause, please. I think they all deserve it. And also a big round of applause for our amazing board of judges for both oral presentation and poster exhibit for all their expertise, dedication, and hard work yesterday and today. Thank you so much. All right, so I know how excited you are to know the winners for both oral presentation and poster exhibit in professional and student categories. So let's not prolong the agony of waiting. So the first set of awards will be for poster exhibit under student category, which will be followed by the professional category. And then next is the oral presentation under student category, which will be followed by the oral presentation under professional category. So to announce the winners, do we have a drum roll? At least a drum roll. So to announce the winners for the poster exhibit, we have the chair of the board of judges of yesterday's poster exhibit. Please welcome Dr. Jennifer Niles.
Okay, I'll be the one to announce po.
Oh, okay. All right. So unfortunately, we don't have Dr. Nilis with us today, but we have one of our judges yesterday.
Okay, so good afternoon again to everyone. Again, I am Maria Grace Rosales, and on behalf of my co-judges, Dr. Jen Niles and Dr. Lucy Daus, we would like to thank the EVHRDC for this invitation to judge in this research paper competition. So to all the contestants, congratulations to all of you. Actually, all of you are already winners because of course, the hard works you put in your research. And we really hope that this competition will be a sweet memory for all of you and that you will not only stop from here. You can either pursue on publication and patents, especially for all the papers that really shows potential for patents. So without further ado, I will now be announcing the winners for the undergraduate category. So let's start with the third prize winner. Wala bang drum roll? So I do not know what yung prize for the winner, but definitely the third prize winner will receive a certificate of recognition for being the third prize winner. So the third prize winner for the undergraduate category of the research poster competition is the paper entitled Perceived Risk and Knowledge on Dengue Vaccination among parents with children 16 years old and below. So the authors includes Mr. Godfrey Bayudan and his team. So let us please give a virtual round of applause to all the team for their efforts and for the presentation of their paper. Okay, may picture taking po ba sila?
Yes, we'll just make sure that we spotlight the presenter. Yes.
Hello, ma'am. Good afternoon.
Good afternoon. Will you please turn on your video so we can spotlight you? Yes. There you have it.
Hello, ma'am. Ay, sorry, wala. I have the background.
It's okay. Okay.
Okay na ba?
All right. Yes. In 3, 2, 1. Thank you.
Okay.
Congratulations.
Congratulations to the winners. And now for the second place. The second place winner is with the paper entitled Assessment of Mother's Knowledge, Attitudes, and Practices Towards Child Vaccination in Barangay San Isidro, Zumaraga, Samar. And the authors of the paper includes Jessica P. Asim, Kent Jericho B. Babon, Maricar I. Bulan, Fritzy D. Mabubay, Antoinette Pacantara, and Jodelson C. Tenedero. Congratulations.
All right, Ms. Mabubay, can you please turn on your video for the picture taking? Thank you.
Hello, ma'am.
All right, so there you have it. In 3, 2, 1, smile. All right, thank you and congratulations.
Thank you so much, ma'am. Thank you so much.
Congratulations.
Thank you, ma'am. Thank you so much.
Even though the scoring of the knowledge is, you have different scoring, but still we find the paper interesting and really worth of winning this contest.
Yes, ma'am. Thank you. Thank you so much.
Thank you also and congratulations. And now for the first place. With a paper entitled Antibacterial, Anticoagulant, and Antioxidant Screening of Blue Ternate. Citoria ternatea L. Flower aqueous extract. And may I just read the certificate of recognition? So the Eastern Visayas Health Research and Development Consortium awards this plaque of recognition to Roque Merrick A. Daculio for winning first place in the poster exhibit category under the student category for the research paper entitled Antibacterial, Anticoagulant, and Antioxidant Screening of Blue Ternate, Clitoria ternate L, flower aqueous extracts during the 2020 Regional Health Research Symposium with the theme Research and Innovation for Accessible, Equitable, and High-Quality Health Solutions Amidst Global Health Crisis held on October 29 and 30, 2020 via Zoom. Signed, Dr. Minerva P. Molon, MD, MPH, FPPA, CESO3, Regional Director, DOH Region 8, and Chair of the EVHRDC Executive Committee. May I call on the winners for a photo shoot or photograph?
All right. So congratulations, Mr. Daculio. So to take your picture, of course, we don't want to, take away this moment from you. So we'll take your picture in 3, 2, 1. All right. Thank you so much and congratulations. So again, congratulations to our winners for the student category. Okay. Shall we now move on to the announcement of winners for the professional category?
Okay, so congratulations to all the winners of the undergraduate category. So at this point, we will now be announcing the winners for the professional category. And to start, we will be announcing the winner of the third place or the third place winner. So with the paper entitled Amylase Inhibitory Activity of Cinnamomum SPP Methanolic Extracts. And in front of you is their plaque of recognition. So the plaque of recognition reads, the Eastern Visayas Health Research and Development Consortium awards this plaque of recognition to Maria Lee Islugsanay for winning third place in the poster exhibit category for the professional category for the research paper entitled Amylase Inhibitory Activity of Cinnamomum Species Methanolic Extracts during the 2020 Regional Health Research Symposium with the theme Research and Innovation for Accessible, Equitable, and High-Quality Health Solutions Amidst Global Health Crisis, held on October 29 and 30, 2020 via Zoom. Given this 30th day of October 2020 via virtual Zoom meeting, signed Minerva P. Molon, MD, MPH, FPPA, SOT. So congratulations, Miss
Thank you,
Maria
ma'am.
Sanay.
All right, congratulations, Miss Lugsanay. And now to take your picture, we count 3, 3, 2, 1. There you have it. Thank you and congratulations.
Okay, so the second place goes to the paper entitled Frying Cycle Affects Chemical Qualities, Histopathology, and LD50 Establishment of Used Coconut Oil in Jackfruit, Artocarpus heterophilus lam, Vacuum Frying. So in front of you is a plaque of recognition awarded to the team. So it reads, the same plaque of recognition awarded to Jason D. Braga for winning second place in the poster exhibit under the professional category for the research paper entitled Frying Cycle Affects Chemical Qualities, Histopathology, and LD50 Establishment of Used Coconut Oil in Jackfruit, Artocarpus heterophilus lam, Vacuum Frying, during the 2020 Regional Health Research Symposium with the theme Research and Innovation for Accessible, Equitable, and High-Quality Health Solutions Amidst Global Health Crisis, given the 30th day of October 2020 via Zoom virtual meeting, signed Dr. Minerva P. Molon. Congratulations.
Thank you so much, ma'am.
Thank you, and congratulations, Mr. Braga. So show us your winning smile in 3, 2, 1. Thank you.
Thank you.
And now for the first place. So the first place goes to the paper entitled A Surface Plasmon Resonance and Water Quality Monitoring, a Method in the Detection and Prediction of Harmful Algal Bloom. And again, a plaque of recognition is in front of you, which reads the same. The Eastern Visayas Health Research and Development Consortium awards this plaque of recognition to Walves MC Alcos for winning first place in the poster exhibit under the professional category for the research paper entitled A Surface Plasmon Resonance and Water Quality Monitoring, a Method in the Detection and Prediction of Harmful Algal Bloom, during the 2020 Regional Health Research Symposium with the theme Research and Innovation for Accessible, Equitable, and High-Quality Health Solution Amidst Global Health Crisis, given this 30th day of October via virtual Zoom meeting, signed Dr. Minerva P. Molon. Again, congratulations, Mr. Alcos, for winning the first place for this poster competition under the professional category.
Thank you, ma'am. Congratulations, Mr. Alcos. All right, so let's take your picture, of course, in 3, 2, 1. There you have it. Congratulations. And also to all our winners, you all deserve it. And to those who were not able to make it, for us, you are all winners. Okay. Yes, also thank you, Ms. Rosales, for announcing the winners on behalf of the board, of the chair of the Board of Judges. Okay, now let's move on to the awarding of the for the announcement of winners for the oral presentation. Again, we will start with the student category, which will be followed by the professional category. Okay, and now to announce the winners, we have the chair of the Board of Judges for the oral presentation, Dr. Jacinto Blas Mantaring.
Yes, thank you, Amor. So I would like to announce the winners starting from the third place for the oral presentation in the students category. So the plaque of recognition reads, actually it's the same, East Visayas Health Research and Development Consortium awards this plaque of recognition to blank for winning third place in the oral presentation student category for the research paper entitled Mental Health Status and Resilience Among Students in the University in Leyte during the 2020 Regional Health Research Symposium with the theme Research and Innovation for Accessible, Equitable, and High-Quality Health Solutions Amidst the Global Health Crisis. The winner is Arlene Joy C. Gonzaga. Congratulations, Arlene.
All right, congratulations, Ms. Gonzaga. And
Thank
take
you,
your
sir.
picture.
Thank you.
Congratulations.
All right.
That can still
Okay,
be
now to
improved.
take your... Go ahead, Dr. Mantaring. Yes?
No, that. I just wanted to say, pwede pa yang, that your paper can still be made much better.
Yes.
Yes, sir. Thank you so much. I'll take note of
Plenty
that.
of room for improvement.
Okay, now let's take your picture. 1, 2, 3, smile. Congratulations.
Okay, so the next plaque reads the same. The plaque of recognition goes to blank for the research paper entitled Synthesis of Plant-Mediated Silver Nanoparticles. And the winner is Renz Amador Bagas. Renz, where are you?
Mr. Yes? Okay.
I'm here.
Congratulations, Mr. Bagas.
Congratulations.
And we're ready to...
Thank you, Doc.
Yeah. And now we're ready to take your picture in 3, 2, 1. Thank you.
And the first place goes to the paper entitled Extended Spectrum Beta-Lactamase Producing Gram-Negative Bacteria among clinical isolates in selected hospitals in Tacloban City. The winner is Christine Faith Pulga. Congratulations.
Congratulations, Miss Pulga. Could you please turn on your video? There you have it. There you go. Congratulations. And we're going to take your picture. If you can remove your mask, if it's okay to remove your mask. All right, so we're going to take your picture in 3, 2, 1. Thank you and congratulations.
Thank you so much po.
Congratulations.
And
all right, so
thank you, ma'am, sir.
Yep, so those are the winners for the oral presentations under the student category. Now let's move on to the professional category.
For the professional category, the plaque of recognition reads the same. It's awarded to the research paper entitled Community Risk Factors on the Occurrence and Prevention of Diarrhea Outbreak in Eastern Visayas, a Case Control Study. Awarded to Lilibeth G. Mirales.
Congratulations, Dr. Miralles, for winning the 3rd place. And now to take your picture, I'll count 1, 2, 3. In 3, 2, 1, smile. There you have it. Congratulations.
The second place, tama ba? The second place.
Yeah.
Goes to,
yes, that's correct.
For the oral presentation professional category, goes to the paper entitled Classifying DNA Methylation Imbalance Data in Cancer Risk Prediction Using the SMOTE and the TOMEC Link Methods. The award goes to Mirador G. Labador.
Yay, congratulations, Mr. Labrador.
Thank you.
For winning the 2nd place. All right, so in 3, 2, 1.
Please correct the spelling.
Yeah.
Oh yeah, I'm sorry.
Yes.
So it should be
Labrador.
Labrador. Yes.
Labrador
we
as in the dog.
apologize for that. We're gonna edit it for sure. Okay, so let's take your picture in 3, 2, 1. Oh, you just turned off your camera. Okay, again. Let's do it again in 3, 2, 1. Congratulations again, sir.
And I have the pleasure of presenting the grand prize winner, winning 1st place in the oral presentation professional category for the paper entitled, para may suspense, Fear of COVID-19 and Turnover Intentions of Frontline Nurses in the Community. And the winner is Janet Alexis A. De Los Santos. Congratulations, Janet.
Yay, congratulations, Dr. De Los Santos, for winning the 1st place. All right, so I'm ready to take your picture. Let me know if you're okay. All right, in 3. Show us your winning smile, of course. Okay, in 3, 2, 3, 2, 1, smile. All right, thank you so much and congratulations.
Thank you so much. Thank you po.
Congrats.
There you have it, our winners for the oral presentation under the professional category. Again, congratulations to all our winners. You guys all deserve it. And also thank you, Dr. Mantaring, for announcing the winners. Okay, and now to officially close this year's Regional Health Research Symposium, may we call again Dr. Fidelito Tandingo to deliver his closing remarks.
Good afternoon, everyone. Good afternoon again. I'll just, okay. May I request permission to screen share? Okay, there it is. I also prepared a presentation, but this is not part of the contest. So the title of my presentation is the determinants of RHRS 2020 success, the EVHRDC experience. Next slide, please. So this presentation aims to answer the question, what were the determinants of RHRS 2020 success? And next slide, please. Okay, so the objectives of this presentation clarify how the RHRS fits into the overall research process framework of EVHRDC. And second is to identify the individuals and institutions who contributed to the success of RHRS 2020. So the independent variables that I looked at are leadership and governance and human resource. And the dependent variables are the research outputs, quantity and quality, as well as the successful implementation of RHRS 2020. So for my results, result number one is that the RHRS 2020 fits in the overall research process framework of EVHRDC, especially the right arm, this one, from research translation to research utilization. Next slide, please. Result number two is the contributions of the following individuals and institutions were found to be statistically significant. So, of course, the PCHRD, led by Dr. Jaime L. Montoya, Executive Director of the PCHRD, Ms. Karina L. Rebulanan, the Chief of the PCHRD Institution Development Division, Ms. Anisha P. Catameo, of everybody's DFF, Regional Program Officer of EVHRDC. And next, of course, the EVHRDC Executive Committee, co-led by Dr. Minerva Molon, the Regional Director of DOH, and Engineer Canada, the Regional Director of DOST Region 8, and of course, the members of the Executive Committee. Thank you so much. And of course, the EVHRDC management and committees, led by Dr. Lucia P. Daus, the Consortium Director, Ms. Jean Gay Oragub, the EVHRDC Coordinator, and the Chair of the different committees, the Research Management Committee, chaired by Mr. Leonido P. Olobia, the Chair of the Ethics Review Committee, Dr. Jane R. Borinaga, the Chair of the Research Utilization Committee, Dr. Sherry Ann C. Labid, the Chair of the Capacity Building Committee, Dr. Vigildo E. Sabalo, and the Chair of the Structure, Organization, Management, and Evaluation Committee, Dr. Ms. Josephine L. Hipe, and of course, the members of the different committees. And we also would like to recognize and acknowledge the contributions of the EVHRDC member institutions, all the officials and the researchers of the 32 member institutions of EVHRDC. And of course, the RHRS Board of Judges, the contestants, their advisors, and the moderator. So for the oral presentation, the chair of the Board was Dr. Jacinto Blas V. Mantaring, the third. Members were Dr. Noel R. Huban and Mr. Leonido Olobia. For the poster exhibit, the chair was Dr. Jennifer M. Niles, and members were Dr. Lucia P. Daus and Ms. Maria Grace C. Rosales. And of course, the moderator was Ms. April Rose L. Amor. And not to forget, of course, our ever hardworking EVHRDC Secretariat. Thank you so much to everyone. And special mention to our Zoom bombers, the Christmas bells, and I think I heard children and also some puppies. And may I request the next slide, please. So for the summary of findings, conclusions, and recommendations, the RHRS provides an effective platform for local health researchers to disseminate the research findings and be recognized for their work. The findings in this research line up with the initial hypothesis. The success of the RHRS 2020 was due to the invaluable contributions of numerous individuals and institutions. The study concludes that RHRS 2020 was a resounding success. It is recommended that the RHRS will continue to be organized annually as one of the consortium's contributions towards obtaining better health outcomes and an improved quality of life for families and communities in the Eastern Visayas region. And it is also recommended that appropriate recognition is extended to individuals and institutions who significantly contributed to the success of RHRS 2020. Thank you so much to everyone. So for the work cited, there's only one, the EVHRDC institutional video. And so I think that's my last slide. Thank you to everyone and congratulations.
All right, thank you, Dr.
Galing.
Tanico, for that message. So good job. Good job, everyone. Congratulations to all our winners. Oh, by the way, before I forget, for the final plaque that we'll be giving you, please don't worry. For the other authors, we'll be adding your names in the plaques as well, because we believe that you also you should be recognized as well. So again, thank you, everyone. So thank you all for being a great audience today and for bringing your gracious professionalism to the competition. We surely had an excellent event and looking forward to seeing you again next year. Again, my name is April Rose Amor. God bless everyone and stay safe.
The Eastern Visayas Health Research and Development Consortium conducted its first ever Regional Health Research Symposium in a virtual platform on October 29 to 30, 2020. This year, the symposium is anchored in the theme Research and Innovation for Accessible, Equitable, and High-Quality Health Solutions Amidst Global Health Crisis. The primary goal of this symposium was to bring together researchers in the region to disseminate research findings through oral research paper presentations and poster exhibit. In relation to this, the Eastern Visayas Health Research and Development Consortium would like to express its heartfelt thank you for attending this event. Your presence helped to make this event a great success, and your enthusiasm and positive spirit helped make our time together both informative and worthwhile. To the presenters, Board of Judges, resource speakers, EVHRDC committee chairs and members, and participants from different institutions, damo nga salamat.